In the intense world of medical emergencies,
one patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight,
Were you thrown at all?
Yes.
Yeah?
a man is in agony after a motorbike crash,
Mate, this is the worst thing I've ever done.
a cardiac arrest in a supermarket,
If she has another arrest, you're going to do 3 stack shocks if needs be, OK?
a race against time to save a man's foot,
What we could do is to pull it, do a better alignment.
90 degrees isn't good.
and a car crashed into a lamppost, trapping a child inside.
I know it's going to be a bit painful. Just bear with it, be strong, okay?
The critical care team in the West Midlands was set up in 2012.
Police are now on scene saying it is a significant wound.
Thank you, speak soon.
70% of the doctors on the team are consultant anaesthetists, who also work in hospitals all over the region.
We're basically a specialist team, effectively. West Midlands Ambulance Service will respond to between 3,000 and 4,000 calls a day, and the trauma service is commissioned really only 10 patients a day.
There are 34 full-time critical care paramedics who have each undergone a rigorous selection process before a further 18 months training.
So this is our mechanical CPR device, which can take over chest compressions, which is especially handy if we're transporting a patient on an ambulance.
Right. Ready for another thrilling instalment? See what the world has got in store for us today?
40-year-old critical care paramedic Stephen Mitchell, known as Mitch, has been with the team from the beginning.
When you've just enhanced the team or become a team on a job, you know, it does make you proud to be part of the system, and it's a good feeling, I suppose.
Ambulance service, is the patient breathing? Well, I think she's fine. She's suffering to blue.
Is she awake?
No, she's not conscious. Is her breathing noisy? Yes. I need you to look at her chest for me to see if it's rising and falling regularly. She's breathing, but she's grunting, breathing in the face. Please. We are coming as quickly as we can, okay? Ambulance and siren.
An ambulance has been called to a local supermarket where the woman works, and Mitch has also been scrambled.
Chris has just given us an update about a job that's in Albury. Somebody who's collapsed in a supermarket. I believe it's cardiac arrest. Crew's 5 minutes away, or we're 5 minutes away. They should be there by now. But really, these patients need quick management.
Without a heartbeat, the human body can store between 3 to 5 minutes worth of oxygen. But after that, the brain and major organs begin to shut down.
Not night. Do you know an approximate age?
With no information to go on, Mitch and the ambulance crew must act fast if the patient's life is going to be saved.
Long here. You're right. Oosh, ah.
5 minutes after he received the call, Mitch arrives at the scene.
Okay. You're right, guys. How you doing? Keep her on the side.
Yeah. She's had 3 shots.
What are you?
Yeah, no drugs given. GCS on the
Just,
now.
you've got just a normal O2 mask. That's it. We'll just get a free flow.
45-year-old employee Joe was at work stacking shelves when she collapsed. Luckily for her, the ambulance crew arrived within 2 minutes and managed to restart her heart.
Well done, guys. Okay. She's got a candle in.
Yes, she's got
So, keep her on the side there.
family behind.
Yeah, gotcha.
And then work, Colin.
The paramedics have hooked Joe up to an electrocardiogram, which shows a very agitated heart rhythm.
That 12 lead, did you see anything on it?
Came back as stomach.
Mitch knows there's a real chance she may rearrest again at any moment.
Okay.
Daughter-in-law, are you a daughter-in-law?
Yeah.
Come here. Okay. What's the name?
Jade.
Jade. She's obviously had a cardiac event where they've had to defibrillate her, okay? So she's quite poorly, but we're looking after her. It's good that she's away.
Joe's brain was deprived of oxygen for several minutes, which has left her confused. Mitch needs to calm her down to minimise the stress on her heart.
I need you to sort of be around and talk to her. So if you go behind my colleague there, you just talk to her. Just.
Joe, we've got Jade here for you.
Jade's there.
The team now need to get Joe to hospital as quickly as possible. It's her best chance of survival if she does have another cardiac arrest.
It's the ambulance, okay? Just. So.
Nottingham connecting a multiple request for ambulance and fire brigade.
Operator, hello, caller. Is the patient breathing?
I'm not sure it's a car crash, but they're stuck in the car.
How many vehicles involved?
Just one.
And what have they actually gone into?
Come off the road and gone into the curb and hit a lamppost. One person stuck inside. He's in a lot of pain.
Is that him screaming?
Yeah.
A major road traffic collision requires all the emergency services working together to save lives.
Next.
The critical care team on duty tonight are Dr. Ben Taylor and critical care paramedic Aidan Brown.
Patient still trapped to the left knee down the 11-year-old male in the back of a
The passenger trapped in the back of the smashed vehicle is a young boy. A child's life is in danger, and Dr. Ben knows there's a lot that can go wrong.
Because obviously it's a very cold night tonight, it's 4 degrees Celsius. Physiologically, children are different from adults. They get colder quicker. They tend to compensate very well physiologically in terms of blood pressure and so on until they don't. So they've got the potential to become sicker very suddenly.
The police have arrived on scene, along with the fire brigade and ambulance crew. It's a big impact smash, and the boy's condition is deteriorating fast.
That's all received, many thanks. We're just approaching scene now.
The critical care team in the West Midlands was set up to improve the chances of survival to hospital for seriously ill and injured patients.
Monitor on there, oxygen down there.
Yeah, perfect.
Together with the Midlands Air Ambulance, the highly qualified doctors and paramedics fly around 6 missions a day,
03, we are lifted from Cosford.
covering an almost 6,000 square mile region.
ETA 10 minutes.
On the ground, they rely on a fleet of high-powered vehicles to get to each emergency in the fastest time possible.
Turn right here.
Will Meadows has recently completed his 18 months advanced training to become a critical care paramedic. As this is one of his first shifts, he's being accompanied by Colin Apps.
I've been working for West Mids for about 19 years, but Midlands Air Ambulance for about I think nearly 11 years now. Today I'm just doing the support shift for Will, so...
You're my mentor, my role model and mentor.
I'm not getting involved. I'm happy to sort of stay quiet in the background.
Be calm, mate.
Ambulance service, is the patient breathing?
Fuck, yes, this is a serious cut to his right wrist.
Okay, is he conscious?
Yes.
I'll be able to speak to him?
No, he's in.
Can you ask him how he's done this?
Have you looked, mate? Cancel. No, mate.
They're coming as quickly as possible. Is it gone grey in the face? Is he a deathly colour?
Oh, Jesus. Yes. Relax, yo.
Keep supplying that pressure until we get there. They're coming on a blue light.
An ambulance has been called, but the man's condition is so serious, critical care backup is needed, so Will and Colin are also en route.
So it's a 26-year-old male who's sliced his arm with a tool of some sort, bleeding quite heavily, and apparently he's now unconscious.
If the man's unconscious because he's losing too much blood, he could be about to go into cardiac arrest.
He's had to be put on the floor, legs raised. There's a crew only a couple of minutes away, so we should get an early update.
They're going to be gone. There's 6-2 get hit.
6-2, I've just spoken to the crew. They say the patient was in the street. They've got him onto the back of the ambulance. He's GCS 15, but looks very grey.
13 minutes after they were called, Will and Colin arrive on scene to be briefed by the ambulance crew.
All right, thanks. My name's Will.
Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm.
Okay.
We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well. Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got my first set of rods done now. Just got him inside because it was so cold, really.
Lovely,
so,
lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Joe, we're just going to slide you back, my darling, all right?
In Oldbury, Mitch is working with the ambulance crew to get 45-year-old supermarket worker Joe to hospital.
If you're happy, mate, what we'll do is we'll just pick her up and then someone feed the stretcher straight in so we're not all like... Right. Well done, guys.
She has suffered a cardiac arrest and is fighting for her life.
You okay, Joe?
Her daughter-in-law, Jade, is also on scene.
Can you just carry on talking to her, Jade? That's it.
She went to the doctor yesterday because she had pain in her arm.
Pain in her arm.
But she couldn't get an appointment. You okay, Joe?
So everybody on the side, pull apart slightly as well. So, and then just watch everybody's toes. Okay.
1, 2, 3.
Okay. Advance. Mind your toes. Okay, lovely. Okay, so guys, can we go a little bit further over that way, and then put her on her side? Okay, because if she vomits,
It's 26 minutes since Joe had a cardiac arrest, but Mitch knows the window for her rearresting is still wide open.
Have we got a little cushion for her for underneath? You know, can I just insist that we keep her on the defib? Sorry, we need to know what's happening, don't we?
Yeah.
The cardiac monitor contains a defibrillator, which can be used to deliver an electrical shock if her heart rearrests.
You ready for a quick update?
9-8, yeah, go ahead. I've got Rocket 1132, if that's correct.
Yeah, female, appears to be in her 50s. I can confirm some details, but looking to go to PCI centre. would you mind just seeing which is the closest? We're thinking city.
6 minutes after he arrived on scene, Mitch has his patient packaged and ready to leave. He radios control to report on her condition.
Yeah, currently GCS 14, heart rate 120, BP 118, 86.
You are in Old Black, you say yes, I'd agree that probably city is your closest.
Nice one. Cheers, Mucker. Yeah, we'll alert direct and appreciate for that.
There is a real chance of Joe re-arresting, so Mitch will travel with her to continue giving emergency care throughout the 4-mile journey.
So, guys, what we're going to do is, if she has another arrest, we're going to do 3 stack shocks if needs be, OK? Happy with that?
Yeah, sound like
OK.
Sorry, Joe. Joe, how are you feeling? Pain.
Liam, just nice and smooth, mate. What we're going to do is we're going to do a cannulation in a bit, but I'll tell you when it is and we'll just pull over slightly, OK? OK, we're just going to put a little needle in your arm, OK, lovely.
The cannula will allow Mitch to administer painkillers directly into her bloodstream, as well as prepping her for immediate treatment at hospital.
Yeah, that's probably from the compressions on your chest. Going to get you sorted, lovely. You're doing really well, OK?
Just 4 minutes later, they arrive at hospital,
Good skills, top marks.
where Mitch delivers his still critically ill but now stable patient to the waiting emergency doctors.
From when we got there, we were met by the crew and they'd reported that they'd just got a ROSC on her, so that sort of really changes the game plan for us. The crew were like literally 2 minutes away, delivered the shock straight away. Her heart was in such a rhythm that it gives the potential to go back into cardiac arrest, and there is like a window of where the heart is like sort of agitated and actually it's quite likely they may go into arrest again. But on the same note, it was like a really good outcome.
Ambulance services, the patient breathing.
Yeah.
Are they awake? Are they conscious?
Yeah.
What's happened, sorry?
We're on a roof. That's what. It's a dislocated.
It's a dislocated ankle.
With a possible right, yeah.
Is he able to talk to me, or?
Yeah, you are able to talk.
So what happened? Did someone just tackle you, or did you?
Someone just.
Does your foot look cold, pale, or blue?
It's covered in a sock and a boot.
Would you say you're in severe pain?
Yeah.
If the man's ankle is fractured, the broken bones could cut off the blood supply to his foot. A time-critical injury that must be treated on scene. So critical care paramedic Pete Edwards is en route.
So we're going to a male in his 40s who apparently has a fractured dislocation of his ankle. There is a crew in attendance who are requesting us, so I suspect it's for advanced analgesia.
The critical care team is trained in the use of high-strength drugs and painkillers, normally only used by doctors so they can carry out procedures in the field.
The ambulance crews carry gas and air or Entonox. They carry IV paracetamol and IV morphine. And then we carry ketamine, which is a much stronger pain relief that gives sort of sedation as well. This is it.
9 minutes after he was called, Pete arrives at the rugby ground.
Hello. Hello, all right.
The ambulance paramedic updates him on the man's condition.
So far, Entonox on the field, onto the stretcher. It's giving me a score about 5 or 6 at the moment, but that's because it's not moving.
Okay.
You can feel sensation all around it. It says it just feels like pressure.
Hello, sir. I can see the problem.
40-year-old Dave was playing a friendly match when a nasty tackle floored him. He was carried from the field by the paramedics and given gas and air for the pain.
Yeah. And we've got a little bit like what looks like some critical skin there, haven't we?
The fracture is so bad that the skin around the ankle bone is dying because of the lack of circulation. If it continues, he could cause lasting nerve damage and he could lose his foot.
Dave, you've obviously got a fractured or a dislocated ankle. Looks like there's a little bit of compromise to the skin because of the bone. What we don't want it to do is the skin over the joint to sort of die or become necrosed, really. What we could do with it really is to pull it to a better alignment.
90 degrees isn't good.
No, I've seen better. I'm going to just uncover you a little bit, all right, so we can get to you. We've got a couple of options, haven't we? We run with it like that on blue lights into the manor, or we could give him a little bit of ketamine and just pull it, you know, to get rid of that critical skin, because obviously that's time critical, isn't it, really?
Administered correctly, ketamine will allow Pete to perform this procedure, putting the broken bones back into position and restoring the vital blood supply to Dave's foot.
Big deep breaths, that's it, all right?
I've got an 11-year-old male in the back of here. He can't get out, he's mechanically trapped from the left leg down. We haven't been able to see anything below there.
In West Bromwich, Dr. Ben Taylor and critical care paramedic Aidan Brown are at the scene of a serious car accident.
I'm going to have a quick assessment, Ben.
A child is trapped in the wreckage with potentially critical injuries. With the temperature near freezing, they need to get him out as quickly as possible.
My initial plan at the moment is once that's all released and clear, look at sort of how he's actually mechanically trapped. If worse comes to worse, it goes a bit downhill a bit quickly, what we'll do, we'll get the telescopic ramp down through the middle, rapid.
That's your plan B, smashing. No worries.
I'm just going to have a go round and have a quick look at that leg, all right?
The police, ambulance service and fire brigade are working together to free him.
Hey, bud. How you doing? My name's Aidan. Right, I'm just going to have a quick look at your leg, OK?
When the car smashed into the lamppost, the front passenger seat was forced backwards and is now pinning the boy's leg to the floor.
Mate, can you just cut that your scissors, mate?
Before they move him, Aidan investigates his trapped leg.
Yeah, mate. It might be broken, OK? So bear with me, OK? I'm going to have to move it. I know it's going to be a bit painful. Just bear with it, be strong, because as soon as we get you out, we're going to give you some strong painkillers.
Getting him out without making his existing injuries worse is going to be a delicate operation.
I think we've got enough room to manoeuvre your leg now. Right, what we're going to have to do, mate, I'm going to lift your leg, OK? We're going to have to get you to shuffle to the back there, OK? So if you want to start shuffling your bum across, I'm going to support your foot.
We'll look after you. It'll hurt a wee bit, but
All
we'll
right,
get you
mate, I've got it. I've got it.
Well done. You're doing very well there.
Well done.
I can't move because it's
Clue.
Frightened and in pain, the boy isn't able to move.
Let's just relax it there a second. Just relax it there.
But Aidan can't wait any longer. This is time critical. The boy has now been trapped for over 42 minutes in the freezing cold and is in extreme danger of becoming hypothermic.
We just get the longboard, like...
Can we get your longboard out your truck, please?
Yeah.
Thank you.
Ben?
Yeah.
And a back splint.
And the back splint. Stand by.
Come, Howard, mate. I'm going to have you out in the warm in just a second.
Aidan oversees the fire brigade as they prepare to get him out.
Yeah, don't worry, we'll help you with that. I want you to lie your head down there for me. I've got your foot. Lie your head down. Well done, mate.
Longboard in position, the crew can now manoeuvre the boy out of the wreckage.
You guys happy there?
Once the feet are clear, you can pendulum them in.
OK, and we want him off the longboard, so we'll need to basically hold it at the side and slide him across if we're happy.
Here we go, mate.
Ready, steady, slide. Well done. Second, OK, get you nice and warmed up, all right?
Finally out of the car, the crew lay the boy on top of the stretcher.
Any pain up here? No? OK, any pain down there?
Yeah. Aidan assesses him and confirms his left ankle and foot are badly damaged, with potential multiple fracture and dislocation.
We'll get him in the door first and we'll do it from there if you're happy.
The blood and nerve supply could also be compromised.
Let's go in there. I bet you're cold now, aren't you? You've been brave lad, haven't you? Very brave. We're just going to go into the ambulance now. You see your fam. All right? Good man.
With a temporary splint on the injured ankle and wrapped in a foil blanket to try and warm him up as quickly as possible, the boy can now be moved into the back of the ambulance.
Any pain in your chest? No?
Aidan carries out a thorough examination of his chest and vital organs to be sure he hasn't suffered any undetected internal injuries.
Ben, I'm happy that it's isolated.
Happy leg.
Tib fib.
Ben, happy for us to clear, crew can transport it out, I thought.
The boy is now in a stable enough condition for Aidan and Dr. Ben to leave him in the sole care of the ambulance crew for the 8-mile journey to Birmingham Children's Hospital.
Took a little bit of time to get him extricated from the vehicle. He's got quite severe lower leg fractures, which will need treatment at a specialist trauma centre.
It's difficult when you go to a child that's the same age as one that you have at home, and it brings home a little bit closer and breaks through the veil a little bit. It's bad enough for an adult to be in that position where they're trapped inside a crash car, probably very scared, probably getting cold, probably in a lot of pain. But as a child, it must be significantly worse and significantly harder.
Yeah, it's
quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But it looks like it.
In Birmingham, critical care paramedics Will Meadows and Colin Apps have been called to an accident on a building site.
How old are you, sir, mate?
26.
So it's a tool that sort of dropped onto his arm.
Yeah, plunge saw.
Like a table saw.
Rich was operating a mechanical saw which got caught in his clothing. The wound is so serious, he's in danger of losing some of the use of his arm.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
Last year, there were 54,000 injuries on building sites.
Do you feel sick at all?
Yeah, a little bit.
A little bit.
This is a 26-year-old chap who is working on a construction site with what he calls a plunge saw.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm, and he sustained an isolated open laceration. It's quite deep. There's a lot of stiff adipose tissue, and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There's no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
What we might do then is pop a little cannula in your arm, give you some paracetamol that way.
How much pain are you in?
Well, it's getting worse as it's go, I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain.
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
Get that arm sorted, right?
Yes, guys, thank you for your help.
Well, there you go. Take care. Get well soon.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew.
Is it okay to pop on just a little bit of oxygen? Is that all right?
8 miles away in Walsall, following a bad tackle on the rugby pitch, critical care paramedic Pete Edwards is about to try and realign the broken bones in Dave's ankle.
Have you ever had ketamine before?
I've had morphine before.
Yeah?
It's been over 40 minutes since the accident. Deprived of blood and oxygen, healthy tissue can suffer irreparable damage, so Pete needs to act fast to restore blood supply to his foot.
He's got dislocated or fractured ankle or both, but what we've got is what we call critical skin over the joint, so that means that the skin is that tight, it's restricting the circulation to it, and it is quite important that we restore circulation. So just going to get a little bit of sedation, try and pull it straight and get into the hospital as quick as we can. Have you given someone Danzatron?
Before Pete injects the ketamine, it's vital he gives Dave a dose of anti-sickness medication to help him tolerate it.
All right, give him a bit of that, is that all right? His observations are all right, aren't they? So that's ketamine, 10 milligrams per mil, so in here is 200 milligrams, all right. Have you seen it given before, Stu?
Ketamine?
Yeah, OK, all right, so it's just have to be no sudden noises. All right, I'm just going to go some very small amounts to start with, all right? It's Paul, isn't it? I might just feel a bit woozy, that's all right?
More nervous?
Yeah, don't worry, all right, OK. We're going in very small increments here, just to gauge a response, all right? Giving you a really small dosage.
The skilled and effective use of drugs like ketamine is a vital part of the critical care team's training. In the wrong setting, it can cause unpleasant psychoactive disturbances, so keeping a calm, controlled environment is very important.
I'll just give that a minute or so just to work in.
As the drugs start to take effect, Pete closely monitors Dave's reactions.
You hear me, Dave? You hear me?
Yeah, okay.
Yeah? Lift your arm.
Pardon?
Lift your arm.
Lift it.
Yeah. OK, all right.
It's a difficult judgment. Not enough, and Dave won't be able to tolerate the pain of manipulating his ankle.
Just give him a little bit more.
Too much, and it could suffer the adverse side effects.
All right, Dave.
With the ketamine now in Dave's system, he is hopefully oblivious to what's going to happen.
OK. I'm going to give it a little go at that, all right? You might shout.
Pete needs to proceed very carefully. There are 3 main bones in the ankle. They could all be broken. And they all need to be correctly aligned if he's going to reverse the damage done by the lack of circulation.
All right, Dave?
Oh, good.
OK, that's a bit better. OK. That looks a bit better alignment. Skin colour's going back as it... Let's just check for a pedal pulse. So just check. Yeah, the critical skin has gone. I've got a good pedal pulse. Cap refill on his foot, although it is cold. OK. Shall we just pop a vacuum splint on that then? And I think that's all good.
It's worked. With the bones now realigned, blood is circulating properly to the foot.
Dave, all done.
Yeah, it's looking better.
So he probably doesn't. He's answering us, but I don't think he knows.
Is that normal for the ketamine?
Yeah, that's a good indicator that it's kicked in. Yeah. Can pop that oxygen mask back on him just for a sec. I mean, he's satisfying, but.
Pete encases the ankle in a splint to create a rigid support for the journey to hospital.
Now he's relaxed. Look, it's come back. There we go. OK, yeah. I'll put a bit of traction on, and you put that vacuum splint on. Yep. If we just keep our eye on it. Super. So I can see it. Skin's good. OK, that's lovely. So Walsall Manor, innit? I think I'm quite happy now. We've got rid of that critical skin, so we could just have a nice steady ride in.
Pete will travel in the back of the ambulance with Dave to keep him under close observation while he's still under the effects of the ketamine.
Are you warm enough?
I think so, yeah.
Yeah? Do you know where you are now? No? It's good stuff, isn't it, that?
Kind of feel floating is the
Yeah,
easiest way
yeah.
to describe the way it feels.
It can take several hours for ketamine to wear off, but Dave shouldn't have any memory of his ankle realignment.
Do you feel like you need anything else for pain, or is it okay?
No, it's okay. It's nice to be able to see that my toe is now actually
pointing the right way.
Yeah, up right other than pointing.
Yeah, it didn't look very good, did it?
No.
We're here now, Dave. You'll be glad to know, all right? Bit of fresh air might just make you feel a bit better as well.
Very light-headed.
He had a little bit of a moment where he was as high as a kite, for want of a better description. He seemed a bit bewildered, you know, what's just happened and where am I? But after a bit, slowly, he was back to as he was as normally, so it was a good result.
We joined together, didn't we?
On this team, yeah, we did. It's just short of 2 years, isn't it?
Yeah.
In the critical care car, paramedics Sarah Foley and Becky Chappell are on their day shift.
It's nice to have the option to do something slightly more, isn't it?
Yeah, definitely.
I think once you've had a few years as a paramedic dealing with general treble 9 calls, it's nice to specialise your skills and increase your knowledge in one specific area and be able to target it. Variety is the spice of life.
Ambulance service, just a patient breathing.
Just had an accident. He passed through his foot.
Okay. Are they breathing at the moment?
He's breathing at the moment when he's in the middle of the road.
So what's happened?
My driver has pulled out and he's just been flying. And he's ripped the whole skin over his foot.
Was he on a motorbike or a push bike?
Motorbike.
Is he bleeding very heavily?
Yeah.
Puddle of blood around?
Up around it. Ankle's literally gone. It's cut open and, you know, showing to move.
Is there any complete or partial amputation?
I'm not quite sure, sir. I can't see it. Is the ambulance on the way, yeah?
Yeah.
White Delta 98.
No, you're not too far from this thing, about 4 minutes. It's RCC, 35 will be car.
That's lovely, thanks Steve. We'll go and have a look.
When a car hits a motorbike, injuries can be complex and life-changing. An ambulance has been dispatched, and Becky and Sarah's enhanced clinical skills are also needed.
All we know at the moment is that there's a leg injury. Somebody's come off a motorcycle, only 2 minutes away.
At the scene, they are briefed by the ambulance crew.
Hi there, you all right?
He was on his bike,
Yeah.
and a car turned right in front of him, and he's got to come off the bike, and I think he might have fractured his ankle.
No KO'd?
No.
No.
20-year-old Jake, a restaurant assistant, was riding home from the motorbike test centre when he crashed into a car. The impact dislodged his boot, throwing him off his bike onto the road in a hard landing that caused several gashes to his foot and injured his ankle.
You felt down all his back and neck and he's got no pain? Yeah, no, as long as you're happy. Can I just have a quick look at it? Would that be all right? You've got no pain anywhere else? No, okay. Were you thrown at all?
Yes.
Yeah? You got no pain higher up in your legs? It is just
That's my
here?
most concern.
Yeah. All right. We'll be able to wash that once you're on the ambulance. Yeah,
Motorbike versus car, no loss of consciousness, appears to be an isolated ankle fracture. No further resources required. Going to grab him on the back of the ambulance and fully assess him.
You're right.
Ruling out further serious injury, Sarah needs to get Jake onto the ambulance to carefully assess the damage to his ankle and lacerated foot.
I'm going to just let go of that for a moment. All right.
Out of 10, mate. How bad is this hurting you? Oh, fucking 11. 10 is the worst pain you've ever had in your life. 10's me cutting your arm off. Mate, this is... It's right up there, yeah? This is the worst thing I've ever done.
Can I cut these before the cannula goes in? Is that all right? It just makes life much easier.
I'm terrible with needles.
All right.
We need to get some pain relief into you, don't we?
There we go.
That's the only way we're going to manage that at the minute.
Okay. Right.
Before Sarah and Becky treat his injuries, Jake needs a cannula inserted into the back of his hand for intravenous pain relief.
Oh, make me miss it, please.
But Jake has a fear of needles.
I'm shit with needles, like absolutely terrifying.
Just talk to me about what happened.
I've just come back from Sutton Coldfield because my theory test is tomorrow for my motorbike.
Oh. Okay. How fast were you going?
I was going about 30.
About 30. Okay. Just look down towards me. So you're going about 30. Were you wearing a helmet? Yeah. And your jacket, is that the only jacket you had on, or?
That jacket, I'm a motorbike jacket.
Yeah.
He's just come straight in front of me and I've gone in.
So you've gone into the side of him then? Because he's gone in front of you?
I think, yeah, morphine and paracetamol. You're okay with paracetamol? You haven't had any in the last 4 hours? Okay, this is just normal paracetamol, but we give it IV and it's actually far more effective giving it IV as a painkiller. Okay, so that's 2021 paracetamol running through. Okay.
The intravenous drugs have been administered, but are going to take a short while to kick in.
My lovely, I'm going to just lift this up from here, okay?
In West Bromwich, critical care paramedics Becky Chappell and Sarah Foley are at the scene of a motorcycle RTC.
She was trying to work out what is grazed and took the skin layers off.
As well as an ankle injury, 20-year-old Jake has a badly lacerated foot. The critical care paramedics are concerned the cuts are so deep they may have exposed bone that could become infected.
Okay, it's just that one really.
A bone infection can be difficult to treat and in extreme cases life-threatening.
That's the one, that's a little bit deeper down here. That.
She was trying to work out what is grazed and took the skin layers off and what could potentially be bone.
Got good circulation, so he's got good pulses. The capillaries. Yeah, let's just put a bit more on. Hurting. Yeah.
12th of July night.
Are you all right to hold that back? Yeah.
Both IV paracetamol and...
Oh, I'll leave that up to you, please.
Yeah,
Satisfied that his wounds haven't revealed the bone, Sarah decides Jake needs an X-ray to check for any breaks.
I think, because we've covered the wounds, he's got such a large haematoma here. Well, we can try it and we'll leave it open over the haematoma then. Okay. And if it eases the pain, great.
A haematoma is a pooling of blood that has leaked from a damaged blood vessel into the surrounding tissue. To ensure the injury is stabilised and the bone supported, Sarah puts the ankle into a vacuum splint for the journey to hospital.
You ever had one of these before? I've never broken a bone in my view or anything like this. We're going to do this, we're going to suck the air out of this, so it's going to go real hard around your ankles and it can't move, okay?
Confident Jake's injuries are not life-threatening, Becky and Sarah are happy to leave him in the care of the ambulance crew.
Jake, all the best. Okay, we'll leave you with these guys. Obviously, just tell them if you need anything further for the paying. All right.
Thank you.
Okay. No, thank you. Yeah, and you guys. He's very lucky, really. He's come off a motorcycle, and at the moment, it looks like he's just he's got an injury to his foot. So it could have been far worse.
in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
No, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a desperate 999 call leads to multiple casualties in a major car crash.
There's people trapped in the car. Covered in blood. And she's screaming.
Where's your worst pain? In your chest?
A woman with asthma suffers a cardiac arrest.
Let's get some adrenaline. We've got 40 seconds until the next rhythm check.
A scooter accident inflicts devastating injuries.
I've got quite a lot of pain there.
Yeah, we're on it, we're on it.
Get your pain sorted out, mate.
And police, fire brigade and ambulance race to the scene of a stabbing.
Any details as to whether conscious breathing or not? Over.
Heavy blood loss.
Right, so that's done. Yeah. So I've got all the amps and kits in here.
At the Queen Elizabeth Hospital in Birmingham, critical care paramedic Ian Locke and Dr. Richard Brown have just dropped off a patient and are restocking their fast response vehicle with drugs and equipment for the rest of the shift.
We're going to try and get all the kit together in good order. So if we are required that we know where the essential kit is ready to go. So organised chaos is how I'd like to describe it.
Hello? I've had a car crash, please, something else. Okay, are you injured? Yeah, really bad, yeah. Okay, all right, listen, what's the address? Where are you? I don't know. Ask somebody to help you. I can't, I'm in the middle of the road. Okay, are you out of the car? Yeah, the car's in the tree. The car's in the tree? Yeah, but my friends are trapped. How many people are in the car? 3. We found you, my love. Okay, stay on the side. I think I broke my back. Ow! Ow! Ow!
4 ambulances, multiple police units and 2 fire engines have been called to the site of the crash.
Mike Delta 98 on channel, leaving QE now.
Critical care backup is also urgently required, so Richard and Ian need to get there fast.
Got 1 male, 2 females, still trapped in the vehicle. One's possibly got an impalement injury on a tree pivot.
Hi, Delta 98, that was all copied. Our ETA is approximately 3 to 4 minutes, over.
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives.
My Delta 98 at scene, over.
Roger, thank you, all see.
Right, Tim. How you doing? You all right?
On arrival, they are briefed by West Midlands Ambulance Tactical Incident Commander Tim, who is coordinating the whole emergency effort.
So we've got one patient that's been ejected on this ambulance here. We've got 3 more in there. One has just been dragged out, a male patient. Got some concerns over his airway. We've got 2 more patients in the back. They're lying on top of each other at the moment, so we're just trying to get a plan to get them out.
Okay.
The 4 friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. One female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have a quick look, because they're pretty much packaged and they can get going.
Okay, right. Can you have a quick eye on this one? Yeah.
If we could also look at the chap that they dragged out that's potentially got airway.
Yeah. There goes, you're right.
How you doing? You okay?
Hello. What have we got? Very quickly.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an atlas for Worcester. Okay.
With her spine immobilised, Ian and Richard decide that she is stable enough to be taken to hospital.
Right, that's patient 1.
An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
That one's going to Worcester. You want to just have a look at the one that's been dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
Is this person in the green shirt on the floor here?
Have a look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all.
Okay.
He started to become battered, rolled to his side. Quite a lot of blood coming back of his airway.
Okay, so I'll just get around that way. We'll just scoop him on his side if that's where he'll be. Can you open your eyes, my friend?
Oh.
Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
It's going one way, isn't it?
Ambulance services, the patient breathing.
The critical care team and Midlands Air Ambulance cover an area of around 6,000 square miles.
203 lifted with an ETA of 4 minutes.
The largest operating area of any specialist trauma unit in the country.
Just coming into the overhead now.
In a 12-hour shift, they will respond to around 8 life-threatening emergencies. The most frequent call-outs are to serious traumas from road traffic collisions and cardiac arrests.
That is our Lucas chest compression device. It's on the specialist platforms such as the critical care car. I think it's going to be rolled out eventually onto the air ambulances as well.
At the start of his shift, critical care paramedic Pete Edwards is testing a mechanical resuscitation device not carried on ambulances, but included as standard on the critical care team's cars.
It does continuous chest compressions, and it's a machine, it's automated, so you don't get operator fatigue. It frees up a pair of hands on scene if you're short of resources. And also, if we're going to transport the patient to hospital in cardiac arrest, it makes the journey a lot safer because you don't have to have somebody standing up in a moving vehicle doing CPR. It's all in there.
Ambulance services, the patient breathing?
No.
No breathing at all?
No.
Patient male or female?
Female.
How old is she?
How old is she, ma'am? 40, 50?
Do you have access to an automatic defibrillator?
No.
No, OK. I'm going to tell you how to do CPR. Get her flat on her back on the floor.
She's not breathing in her face, she's going just like that.
OK, well, the quicker we start CPR, the more chance she's got then, darling. Keep pushing hard and fast until anything changes. So the rate we go in is 1, 2, 3. 1, 2, 3. 1, 2, 3. Keep going.
6-2.
6-2, subject arrest, 50 rolled.
That's all received, thank you.
Today, Pete is paired with fellow critical care paramedic Mike Andrews. As well as the critical care team, ambulance crews and a specialist resuscitation unit have all been called to the scene.
It's a patient who's in their 50s, who's in cardiac arrest. That's not been confirmed yet because we don't have any resources on scene, although they should be, just according to dispatch.
With cardiac arrests, time is everything. Every minute that goes by without someone attempting a resuscitation, the chances of survival drop by 10%.
Hello, my name's Mike. I'm one of the paramedics. Okay. Hello, guys. You all right there? How do you...
On arrival, ambulance crew members are working hard to save support worker Vanessa.
Okay, was she asystolic when you got here?
Yeah.
Okay, so first crew, she was asystolic.
Basically, we went out. We did a few rounds of compression. We're trying to get access because we need to give adrenaline.
She has been asystolic without a heartbeat since they got there.
Are you family? Yeah, is it your mum? Your auntie. What's happened? Is she an asthmatic? Okay. Have you found her in cardiac arrest?
Earlier, Vanessa, who was alone at the time, called a relative to tell them she was having an asthma attack. When she failed to answer her phone after they called back, her nephew went round and found the 50-year-old collapsed. No one knows how long ago her heart stopped beating.
We've got an ideal in airway and tidal's a little bit low, so we just need to go slow on the ventilations.
Okay.
And we're just getting the reversible courses now.
I'll tell you what, I'll come around the top end. Do you want to run it and I'll go to the top end?
All right.
Mike and Pete will now take over advanced life support. Because Vanessa doesn't have a heartbeat, it can't be shocked back into a workable rhythm with a defibrillator. So they will use chest compressions and drugs to try to get it started again.
Okay, should we pause for a quick rhythm check so we can all reset and we get our timings right? So, okay, let's check for pulse in 2 places, please.
Nothing here, mate.
Okay, so that looks like asystole to me. Back on the chest then for 2 minutes, and let's see where we're going.
After each cycle of chest compressions, Pete checks to see if there is the slightest spark of life.
Hello, how you doing? Hello there, all right, how's it going?
What do you want us to be doing?
We've got this lady, known asthmatic. She's found a relative.
3 members of the West Midlands care team, specialists in accidents and resuscitation, arrive on scene.
So, just done a pulse check. We're 1 minute 20 to the next pulse check, but she's in asystole, so we're going to start trying to redress some reversible causes. Okay, all right, so have we got any access? Okay, let's get some adrenaline and the glucose set up if we can. You got in glucose, yeah? You're doing the adrenaline. Okay.
Adrenaline and glucose are stimulants that could trigger activity in Vanessa's heart.
Everybody, just a second. 15 seconds from next pulse check. We're going to take a little break in CPR and get the Lucas device on. So 8 seconds, if everybody just stands back while the care team get the Lucas device deployed. So 3, 2, 1, okay. Quick pulse check, rhythm check. It's still asystole.
After 18 minutes of manual CPR, the Lucas machine will now take over chest compressions.
So we've got continuous CPR going now.
The entire team are doing everything they can, but with Vanessa still showing no signs of life, Pete knows they don't have much time left to save her.
Can we just do a pulse check? What have we got there?
Write it all down.
Okay, there's no pulse.
Okay.
Are you happy on your side or lying on your back?
In Redditch, Ian and Richard are at the scene of a serious road traffic accident.
Can you lift this leg for me?
The driver is on the ground, semi-conscious. The full extent of his injuries is still unknown.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go, just roll onto your back, my friend. Go on Watch your back. There you go.
With the help of the fire brigade, the man is rolled over.
Guys, are you okay just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
On the, You stay there, bro. We're going to get you on the ambulance, okay? Well done.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car.
How you doing? Okay.
Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we've just had a quick once over the ambulance. She's empty trauma tool negative, so we said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers.
Scoot, please.
One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast.
If you get to the point we want to intervene further, we'll just give a shout, pull over, jump on in the back, and then we'll go from there. Is that all right? Okay. Happy?
Yeah.
Yeah.
Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, he looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Arriving at hospital, Ian and Richard deliver their critically ill patient to the waiting emergency doctors.
So it's quite a different job, that from what you're probably used to dealing with. So significant ITC with quite a few patients.
After a complex multi-service job, everyone can take stock and learn valuable lessons for the future.
It's very important, so particularly that job where there's lots of people there working and lots of things going on. It's quite useful to, at the end, go through what happened at the job, what we did, what could have been done better, and it's quite useful for the crews, for their learning, because most of the regular ambulance crews don't go to jobs like that very often at all, probably once a year, if that.
It's Wednesday night, and Dr. Scott Beattie and critical care paramedic Will Meadows are at the beginning of a 12-hour night shift.
Just ahead, turn left.
Dr. Scott is a consultant in emergency medicine at Salford Royal Emergency Department in Greater Manchester and does a shift a week for the critical care team.
I can't think of a more textbook definition of a team that, in terms that everyone comes from a different background, but we're much better as a unit because we bring all our different skills and it all just comes together. It's a very dynamic team.
Will has recently completed his advanced critical care training, and this is his first night as part of the all-night trauma response unit.
This is my first shift. First sort of solo shift with the doc. So Scott's got his hands full tonight.
Au contraire.
Ambulance service, please.
Hello.
Can you have assistance to kitchen lane for a stabbing?
A stabbing, okay. And what's the address to come to?
Near the top of kitchen lane, bleeding heavily to the chest, man is barely talking. He's just found him.
Stabbed to the chest, was that?
Yeah, stabbed to the chest.
Attacker on scene?
Not known. He's a passerby that's come across him.
The police have requested an ambulance to attend the scene of a reported stabbing. With a man's life in danger, critical care backup is urgently needed.
9-8.
Right, stabbing in the chest.
Yeah, any details as to whether conscious breathing or not, over?
Nope, there's not even a big assigned to it. I don't think they've even got the location quite right yet, but heavy blood loss.
82, over.
Last year, there were almost 4,000 knife crimes in the West Midlands. It's an ever-increasing part of the critical care team's workload.
So reports of a stabbing of a male stabbed in the chest with heavy blood loss, but we're not sure of any other details at this stage. But certainly heavy blood loss suggests that something fairly significant has been damaged. Even the smallest of little wounds could go in a very long way and hit some fairly vital organs. So quite complex, quite worrying.
If the blade has cut an artery or punctured a major organ, the man could bleed out and die in minutes. Scotland will know that the sooner they get there, the better chance they have of saving his life.
Airway is good, so
airway's good with the eyes, mate.
We're doing hypoxia. Yeah. Hypovolemia. We've got fluids.
That's glucose for you.
Okay, so we're doing the BM as a metabolic disorder.
In Edgbaston, critical care paramedics Mike Andrews and Pete Edwards are leading the team fighting to save 50-year-old asthmatic Vanessa, who was found collapsed with no heartbeat.
We've got 40 seconds until the next rhythm check.
But after 20 minutes of fighting to get her heart started, there is still no sign of life. Several of her family members are in the next room.
Will this move under her legs? Let's raise her legs, see if that helps anything. Okay, so if you push something under there, or that little table, whatever's easiest.
By raising Vanessa's legs, Pete hopes gravity will send blood closer to her heart and may prompt it to restart.
That's it, love. Okay, that'll do. And let's just keep her legs there. I know it's created a bit less room, but we've raised her legs a little bit. All right.
No one is sure how long before Vanessa was found her heart stopped beating, and time is running out for them to save her.
Can I just stop us there? We're just due the next pulse check. Okay, that's pulse check there. No adrenaline on this cycle. Be the next one.
So there's no pulse at the carotid.
And end tidal is 1.3 despite 20 minutes of good ALS. Well, can somebody have to have a chat with family regarding that, or is that all right? And I'll continue with timings. Is that all right? Okay, yeah, let's continue.
Because they attend only the most serious cases, critical care paramedics see death day in, day out.
Is anybody in a position to find out the time of the call?
Their hardest decision is always when to stop trying to save a life.
So, what we're just thinking is, we've got an unknown downtime. We have had some CPR on crew arrival, but we don't know when she's actually arrested, and blue on arrival apparently. So the things that are going against us, she's not been in a shockable rhythm at any point. We've done 20 minutes of ALS.
20 minutes on the monitor.
Okay. Do we need to reconsult family? Or are you happy with that, Bobby? Has anybody got any objections to stopping? Okay, is everybody happy to stopping? Recognition of life extinct. By my time, that's 16:13.
A crew member informs Vanessa's relatives that despite their best efforts, she has died.
Shut the door.
Yeah, definitely. So, on lift, ready, still. Lift. You too. Yeah.
Yeah, but I feel up there right now.
It can be emotionally draining, I think, but at the same time, you have to sort of detach yourself from the emotional side of it if you can. There will always be jobs where you can't detach yourself. There'll always be those jobs that always stick in our minds that we all keep locked away somewhere, the jobs that, you know, you can't really forget. But I think you've got to be quite thick-skinned.
There are more than 30,000 out-of-hospital cardiac arrests in the UK every year. The overall survival rate is just 1 in 10. In Wolverhampton, Dr. Scott Beattie and critical care paramedic Will Meadows are en route to a stabbing. A passerby called police after he found a man with a serious chest wound lying by the side of the road.
4668, thank you. There will details of hospital.
Is there an RVP or they haven't told us one, have they?
With violent incidents like stabbings where multiple units are scrambled, police usually arrive first and secure the scene, while ambulance and critical care crews head to a meeting point nearby.
Just to confirm with you, you will be the first ambulance resource in attendance. We've had nothing come back from police.
Mike Delta 98, sorry, just to clarify, are we heading to an RVP or can we go straight to scene over?
Not just getting an update from police. I'll take it straight to scene. Police are in the vicinity.
98, yeah, perfect. We have approximately 4 minutes left to run over.
For the critical care team, reducing the number of deaths from stabbings is a top priority.
Nothing Seaton, not clear.
Their skills and experience with treating major bleeding and shock are vital when it comes to saving lives.
Okay, that's received, thank you. Are police first? Are you made contact with her? No, we're just placing her. They are just in the area, so if you could just see if you can locate and call back on her. No problem.
The ambulance crew has just arrived on scene, but with no sign of the incident or police, they radio back to control for further instructions. It's now been 14 minutes since the emergency call was made.
Whiskey 55, liaise with police. It looks like it may be a malicious call. They're calling the caller back and trying to make contact with them.
At the moment, the impression from the police and the first crews on scene is that, yeah, it's a malicious call. Unfortunately, it's not uncommon. We get a fair few. And it's just obviously a significant waste of resources.
You have reached your destination.
Right, going to send you down. I think if there's anything, we'd have found it by now.
Yeah, 98, understood. Oh. Yard.
With no sign of any stabbing victim, the police have decided that it's been a hoax call and a wasted journey for everyone.
Always make contact with medics. Going to stand the crew and myself now. Police standing down.
Last year, West Midlands Ambulance Service received over 1,000 malicious calls. In the time they've been dealing with this prank, Ambulance Control have taken 50 real emergency calls.
I guess you don't feel quite so bad. It's when you launch the helicopters, you're up in the sky and everything, and that's just a huge amount of money wasted for someone's entertainment.
Ambulance service to patient breathing.
There's been an accident on the Litchfield Road by the traffic light. A BMW has just knocked a man off his bike.
Is the patient breathing and conscious?
He's got pains in his chest.
Right, is he awake?
Yes, he's awake. Don't move him. Don't move him. He's got chest pain and I think all down the left-hand side. All down the left-hand side really hurt.
Push bike or a motorbike?
He was on a small motorbike. He's going slightly blue. Sweetheart, his lips are going blue.
Would you say that he's struggling desperately for breath?
Desperately for breath, yeah.
Okay. Got a crew on the way to you.
When a car hits a motorbike, even at low speed, the injuries inflicted can be life-changing. An ambulance has been called and critical care paramedic Steve Mitchell, known as Mitch, has also been scrambled.
We're just off to Aston. It's about 10 minutes away to a car versus motorcyclist. Believe the patient's conscious, got a chest injury, and that's as far as we know, really. There's a crew on the way, and they'll be there before us.
If the man is struggling to breathe, he may have an obstructed airway. Mitch carries advanced airway equipment, including ventilators, so he can start treatment straight away and get him to hospital safely.
Hey up, you're all right, mate. How's it going?
10 minutes later, Mitch arrives at the scene and is met by fire brigade and ambulance crew.
No worries. I'm here. What's your name, sir?
Ian Allen.
Ian. What we'll do is we'll get you in the warm, dust you off a bit.
Yeah, okay.
All right.
47-year-old railway worker Ian was on his way back from work on his scooter when a car collided with him at a crossroads, catapulting him onto the road.
And is it your left shoulder, right shoulder?
All the left.
All the left, okay.
He is breathing on his own, but in a lot of pain.
It looks like he's probably dislocated or broken by the sounds of things. It's all right, just so don't pull anything.
There's a high chance Ian has injured his spine in the collision, so the ambulance crew have immobilised his head and neck to try and protect him from further damage.
On your count, Chief.
After 3, 1, 2, 3, lift.
Okay, stay as you are, and then slide the trolley in. Mind your toes, gently. Okay, keep going. I'll get the winch off.
Worried that the slightest jolt could leave him with permanent spinal damage, Mitch needs to use the winch to pull the stretcher up the ramp.
Okay, stop there. Okay, 1 foot, 2, half 6 inches, that's it, go. Hold on. Okay, slack taken up there, okay. Just makes it a bit smoother for you.
Once on the ambulance, Mitch needs to do a full examination to try and find the extent of Ian's injuries.
Yeah, I'm in a bit of pain.
Okay.
Can you get some gas in there, mate?
I could do some water.
Courtney, you all right to get some morphine drawn up and some paracetamol? He's in a lot of pain.
Well, yeah, I'm in pain, yeah.
Okay, here's a little bit of water. Just wet the whistle. Out of 10, how bad would you say the pain is in your arm?
Pretty bad.
10 being the worst ever.
It just feels like there's something wrong there.
Yeah, it will be.
It's my chest.
Your chest?
Shoulder.
Yeah.
All round there. It's really pain. It feels as if...
Chest up here as well?
Further down here.
There. Okay, right, okay.
Ian is in so much pain, it's clear that he has sustained some broken bones and potentially damaged internal organs.
Keep your arm low for me, Ian, okay, so we can pop a little needle in there.
Mitch's first priority is to reduce his pain so he can get him to hospital fast.
Get your pain sorted out, mate.
Ambulance service, patient breathing.
He is, but it's not very good.
She conscious, the patient?
No.
Not responding?
No.
How old's the patient?
Not really sure. He's 1934.
So he's 85 years old and he's not responding to at the moment, to confirm,
No, he's very, very pale in colour. Very pale.
Is he taking regular breaths at the moment? Is his chest rising and falling evenly?
No.
Right, I hope it's all been arranged for him, okay? We are trying to get there as quick as we can on blue lights and sirens, okay?
The call is from a local care home. It is classed as a cardiac arrest, a code red emergency. An ambulance is en route, but critical care paramedics Alistair McNeil and Mike Andrews have also been scrambled.
What looks like a nursing home or sheltered accommodation for a cardiac arrest. Charlie 1 call, We're responding as we are one of the closest resources to the case. We have another crew that are en route as well, but no one on scene yet, as far as we know.
In the UK, around 7.5 million people are living with heart disease. As we get older, the heart and blood vessels stiffen, meaning the elderly are at greater risk of sudden cardiac arrest.
This is the time of the morning when people are getting up and they're moving around, and carers are making their first sort of visits of the day, so this sort of case is not uncommon at this time of day. A lot of the time they're hypoglycemic patients, so they're diabetics or even non-diabetics whose blood sugar has gone low and they've been found in an unconscious state.
Still a couple of minutes away from the care home, Alistair and Mike know they need to get there fast if they are going to intervene and save the man's life.
What we're going to do is we're going to get a needle in you, give you some pain relief through there, and that'll help the breathing, all right? Clench your fist a few times. That's it.
In Aston, Mitch is treating 47-year-old Ian, who was knocked off his scooter and has suffered serious chest injuries.
So he sat for 95 on air, just sort of coming up quite quickly there as well.
4 litres there?
I'd go up a bit. Yeah, he's having a bit of difficulty breathing, I think, and like what's happened. Sharp scratch then. Okay.
Ian needs an urgent scan of his chest and lungs and is in so much pain it's affecting his breathing.
Yeah, sorry, Chief. Well,
I'm in a lot more pain than I was out there.
yeah, it kicks in once your own painkillers wear out your system. If you want to chuck us that morphine, I think.
Any allergies at all then?
Not really, no.
So this will make you feel a bit fuzzy, OK? Out of 10, how bad would you say the pain is there?
I'd say it's pretty bad. I'd say it's about 8 out.
About 8 out of 10, and you look like a burly chap that can take a bit of pain.
Ian's blood is showing low oxygen levels. He may have damaged his ribs and lungs, but until he can get on top of his pain, Mitch can't be sure of the extent of his injuries.
Can we just pop your head forward slightly? Not too much, not too much. Rest your head back. Rest your head back. OK. How's that? Can you feel that starting to kick in a little bit there?
Yeah, I'm a big bloke and want to get round.
Yeah. Nice slow breaths if you can. How's the pain doing there, Ian?
It's subsiding, but it's still there.
Yeah, OK, we'll get you. Yeah.
Have you put the morphine?
Yeah, that's gone through.
Yeah, it's gone through.
It's working now.
Yeah.
14, 20, it started running through.
Finally, the combination of paracetamol and morphine start to take effect.
Stuttering his respiration now. I'll probably give him a little keep going until you've done the 20, I think.
With Ian still struggling with his breathing, Mitch decides to keep him on oxygen for the journey to hospital.
I will probably end up going QE, I think, because he's got a chest injury.
Yeah.
How old are you, sorry, Ian?
47.
47, OK. Maybe just put a 250 bag of fluid on there, just run the rest of it through, just give him like a bit of a keep open or something like that.
If his blood pressure drops, the intravenous fluids will help to keep him stable.
Are we clearing fracture? Left?
Ribs and shoulder injury. Left, yeah.
Police arrive to get details of the accident, and Mitch calls the trauma desk to update them.
Impacted you?
Well, I've gone into the side room, so
So where did you impact the car?
6-2, go ahead.
Crew are going to convey to the QE. You ready for details?
In the right hand lane.
Yes, fire ahead, Mitch.
So male on a small motorcycle moped. He's got a left shoulder lateral clavicle pain with left sort of lower rib injury, query fractured ribs, equal air entry, but it is affecting his respiration. And in light of his rib injury, I feel that it's suitable for the QE. They'll probably be about 15 minutes from now.
With Ian now in a stable condition, Mitch is happy to leave him in the care of the ambulance crew for the journey to hospital.
There's the crew.
In Quinton, Alistair and Mike have been called to a care home where an 85-year-old patient has been found in an unresponsive state, bleeding from the nose.
Good morning. Hello again. Hello again. You're right.
They are met by the ambulance crew, members of the care home staff, and happily a now conscious Ken.
So which nostrils of blood come out?
Both of them, I think.
Both of them.
Ken and his wife Maureen have lived in their apartment in the care home for 8 years. He collapsed this morning getting out of bed.
How is he normally compared to this?
Well, we don't come into him for care.
So you don't know him too well? No.
Well, we know him, but we don't give care to him.
I know me, I'm always pulling the legs in.
Is that what you do?
Yeah.
Oh, keeps them on their toes, I would imagine. So when you sat up, you just felt a little bit dizzy?
Yeah. I stood up and when I got round, there. It happened yesterday as well.
No.
Can I take spot of blood out your finger?
You can have it. Yeah, you can have it from under it. I'll give about 2 points while I've been in there.
Yeah.
You lost a lot from your nose, have you?
You've had no chest pain or anything, have you?
Nothing at all.
I'm just going to...
The crew take a sample to test Ken's blood to see if low blood sugar could have caused him to pass out.
Okay.
He was getting out of bed and the blood not going around my body quick enough.
Did you leap out of bed, did you?
No.
What was that? That normal?
6.9.
6'9"?
Yeah, 36.8 and 6.9.
Are you happy with his ECG and everything?
Yeah, I'll do 12.
The electrocardiogram test hasn't shown up any abnormalities in Ken's heart rhythm.
I can't manage it, like.
No, I know you can't.
If I hadn't given you this word, you'd have been flat on the floor. And I couldn't lift you up.
Happened again yesterday as well.
No, of course it didn't.
But Alistair is concerned that this is the second time he has fainted in 24 hours. The nosebleed could be a sign of high blood pressure or heart disease that needs investigation in hospital.
I don't think there's any need for me to go to us.
But Ken is not convinced.
We'll do all our checks on your Ken and we'll take it from there, mate.
I ain't got to go.
Claire's coming.
I'm not sure if we do.
Ken has a history of fainting when he gets up in the night, but has never had a proper diagnosis.
Did he go to hospital yesterday?
You didn't go to hospital last night, did you, Ken?
No.
You had it happen yesterday, you've had it happen today.
It happened yesterday morning, then he cleared up, not all right.
The carers.
What was his BP, James?
You've got to go in.
123.
You were out for the account.
Got a good run.
Just.
Mike wants the crew to run another ECG scan to see if there are any signs of deterioration or unusual activity.
That's a nice scar you've got on your chest, isn't it?
What's that from?
20 years ago.
No, 20 years ago.
25 years, more than that.
Really? It's indestructible then, maybe.
A veteran of open heart surgery to unblock clogged arteries, Ken is made of stern stuff. But in the end, he listens to medical advice and agrees to go with the ambulance crew to hospital.
Okay, take care. Thanks very much. Thanks a lot, guys. Nice one. We'll leave you to it. We'll see you later on. No doubt. Nice to see you.
And Mike and Alistair are free for their next emergency call. in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
Accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
No, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
Oh no, mate. Oh no, we're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a man collapses in a Wolverhampton churchyard.
Stand clear. 3, 2, 1. Back on the chest, guys.
A police pursuit ends in a major RTC.
He's been ejected from the rear in a car crash.
A pensioner falls down a flight of stairs.
Joe, is it hurting anywhere? I'm pushing here. Yes. Whereabouts?
In your neck.
And a motorcycle crash
That's it, Cameron.
leaves a teenager in agony.
There's lots of things, elements to our job. Save lives, wash cars.
Critical care paramedic Faye Pollock is beginning her first 12-hour shift of the week. It's essential that the emergency car, which is charity funded by Midlands Air Ambulance, is kept in tip-top condition.
The public have paid for it, so actually it deserves to be well looked after and clean and presentable, really. We are a professional body, so therefore we have to have professional vehicles. And it takes 10 minutes to wash a car. But it's freezing, it's so cold. Oh my God, I can't feel my fingers.
Ambulance service. Is the patient breathing and conscious?
Yeah, he's been knocked out. Just a motorbike and car collision.
So it's a car v motorbike. Okay. Can you see any obvious heavy blood loss?
No, I think he might have broke his leg.
I just need to try and rule any life-threatening shock, okay? Does it look very pale or grey to you?
Yeah, we got enough gates on the corner.
All right. Anything else already been arranged? When on blue lights and sirens, okay?
An ambulance has been dispatched, but critical care paramedic Faye is also urgently needed.
There's an ambulance crew in attendance with him. They say that he has got, thank you, sir, a broken leg. He's in quite a bit of pain. They've maxed out on the amount of analgesic drugs that they can give him. So they have requested me to go and give some enhanced care. But if the impact was enough to break his leg, then there might be some underlying injuries that we haven't yet identified, so.
More than 300 motorcyclists are killed and over 5,500 seriously injured every year on Britain's roads.
Ah, yes, I see blue lights.
Faye arrives 17 minutes after receiving the call.
Hello, how you doing? Oh, he's a motorcyclist versus a car, yeah. Cameron, you say? Cameron, listen, my name's Faye, I'm with the Midlands Air Ambulance, okay?
On his way to work, 18-year-old Cameron's motorbike collided with a car. He was thrown off the bike, landing 15 feet away on the grass verge.
This is where you landed?
Where I landed, I flew straight over the bunny.
Okay.
The ambulance crew has already reported that Cameron has a broken leg.
Okay.
Gram of IV paracetamol.
Yeah.
He's on his second bottle of Entinox, but he's in absolute
Agony. Okay.
You know, we can't even get the splint on him. That's why we've asked for a little bit more help.
No problem.
The pain relief given to Cameron by the ambulance crew isn't strong enough. But Faye's special training means she can administer more powerful drugs only carried by the critical care teams.
I'm just going to take your T-shirt off. I know it's absolutely freezing, mate, but you're not bothered. I am.
Before using it, Faye checks Cameron for any other serious injuries.
Any pain in your neck?
No, nothing.
No, okay. Nothing in your throat here?
No,
okay. Any pain in your tummy?
No, nothing.
No, okay. Any pain in your shoulders up here?
No, nothing.
No. Wiggle your right hand for me. Brilliant. Wiggle your left hand for me. Well done. Can you change your bottom cheeks together? That'll do. Okay. It's all this pain in your leg. Okay.
Yeah, just my right.
Cameron has broken his right thigh bone, the largest bone in the body.
Which leg am I touching, left or right? Good man.
There is also the risk Cameron could have broken his pelvis or damaged his spine, which could cause paralysis.
No pain as I'm touching down your back?
No.
No, okay. Okay, wiggle your toes. Good man.
Thankfully, Cameron's spine doesn't appear to have been damaged. Faye can now turn her attention to his broken leg.
All right, Cameron, I'm sorry. It's not helping the fact that it's so bloody cold. Could you plug that into your
Oh my God, my leg's really gone out. Hang on, stop putting pressure.
We're gonna help you now, Cameron. Sorry, my friend.
Faye wants to get Cameron to hospital, but he's in too much pain to be moved.
At the moment, the reason why it's so uncomfortable is because you have broken your leg. Is the two bones are scratching against each other. Okay. As soon as it's in line, you will create your own pain relief because it's back where it should be. All right. It's all set up, isn't it? So if we give him a little shot of ketamine in there.
Straightening his leg is an excruciating procedure, so Faye prepares to give Cameron a powerful painkiller called ketamine.
So Cameron, I'm just going to give you this drug, okay? It will make you feel a little bit sleepy, but it's just so that we can pull. I'm only going to give you a touch so we can pull that leg. The moment we pull it, it'll actually feel... No, trust us. Trust us. 1, 2, 5.
It's essential Faye straightens Cameron's leg as soon as possible. While it's out of alignment, it could be causing internal bleeding with the risk of life-threatening blood clots.
Soon gonna be over, man. Soon gonna be over.
Critical care paramedic Stephen Mitchell is starting the Saturday shift by making sure his kit is ready for whatever the day brings.
It doesn't look tidy enough for my liking. Everything keeps you on your toes, and you almost have to be a certain character type to do this type of job. I think the weather will keep people indoors today, but we'll have to see.
Service, is the patient breathing?
I think no breathing. I touched him, but no reaction.
Okay, is he breathing?
I don't think so.
We need to start CPR.
Yeah.
Okay, put one hand in the centre of his chest and lock your fingers together. You're going to keep your arm straight, push down hard and fast. Don't be afraid to push too hard, okay? You're going to go push, 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 push.
Yep, yep.
Say push out loud every time. Push, 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 push. 1, 2, 3. 1, 2, 3. Keep pushing. Don't stop until they tell you to. Can you see the ambulance anywhere?
Yeah, yeah.
The collapsed man who's not breathing is a code red emergency. Local ambulance crews are on scene, and to help with advanced life-saving treatment, Mitch is also on his way.
So it's reports of a 40-year-old male who's had a cardiac arrest, so hopefully we can help out where we can.
With cardiac arrests, time is crucial. When the heart stops beating, no blood is pumped around the body, starving vital organs of oxygen. Every minute without CPR, the chances of survival drops by 10%.
Hi there, guys. You all right? It's Mitch.
Captain Paramedic passing by.
That's why I was doing CPR, but he said it didn't look that effective, but he was doing his best he could.
The man was found 17 minutes ago, collapsed and in cardiac arrest.
A little bit faster, Chief. Keep your elbows straight. That's it.
He's had 3 shots, and he's had one of them, you know.
OK, what we'll do is we'll go on the next rhythm check at 13 minutes past.
The ambulance crew found the man's heart in VF, or ventricular fibrillation, which means it's quivering rather than beating. Despite using the defibrillator 3 times and administering adrenaline, it has not regained a normal rhythm.
Everybody else stand clear for me. On 1, stand clear. So 3, 2, 1, back on the chest, guys. OK.
The man is only in his early 30s. Mitch and the crew are battling to save his life. Across the West Midlands, the critical care teams are on call 24/7 for all life-threatening emergencies.
BVM. Yeah, on controller's on, reading at 3.0. BP systolic.
You don't know what you're going to. That's part of the challenge, is you're dealing with all sorts of conditions, environments, as well as all sorts of issues with the patient. And you never quite know what you're going to get until you get there. And it's probably the reason that most of us sort of end up in this role.
Just gonna have a little look at your foot, okay?
Nice deep breath.
Well done.
Ambulance services, the patient breathing.
She's breathing, but she's not responding.
Okay. Does her breathing sound noisy? Is there any gurgling or wheezing sounds?
Yeah, it's a gecko. Sue, are you okay?
Is she responding at all?
No, she's giggling.
Just try and roll her on her side, remove anything from under her head and just keep checking this breathing for me, okay?
Okay.
Is she diabetic at all?
No, she's got MS.
She's got MS, okay.
The woman who has multiple sclerosis is unresponsive and struggling to breathe.
It's a 60-year-old female MS patient. She's been found unresponsive this morning, vomiting and aspirating.
A local ambulance is already on scene and has reported the patient, in her 60s, is choking on her own vomit.
She is a bit of a large lady, so they have requested an extra 2 ambulances to assist, and we've got your stuff going as well.
Roger, thank you.
It's a potentially life-threatening incident, so critical care paramedic Kerry Hemus is also en route.
We're not sure what the cause is at the moment, and the crew are having to give her oxygen and assist to ventilations. But I do carry a little bit of different kit with regards to ventilation, so maybe I could assist with that. So I'm kind of thinking that through in my head. She's apparently a larger lady, so it's not going to be as easy as just sort of popping her on a chair or a scoop and just getting her out of there.
Kerry arrives on scene. 3 ambulance crews are already there.
Hiya. Hello there. Hi all. Hello. Hello. That's fine.
Found my carers this morning.
Yeah. Does this lady live alone?
She does, yeah.
And what level of care do you know?
Full time today, all care. She's a little bit wheezy.
62-year-old Susan has multiple sclerosis, an incurable, sometimes debilitating disease affecting the central nervous system.
What was her last blood pressure? Okay.
Susan, open your eyes for me, Flower.
The ambulance crew has cleared her airway of vomit and she has been given oxygen to assist her breathing.
Right. So what's her rest rate now?
20.
20, lovely. Bless her.
Susan, hello.
She's very warm, isn't she?
She's got fentanyl patch which was removed.
Right.
Fluids. She's had 800.
So she's had it every 3 to 5 minute loops.
Susan was wearing a slow-release fentanyl patch for pain relief for an existing condition. Worried she may have received too much of the strong painkiller, the paramedics have removed the patch and are giving her Narcan, a drug that reverses the effects of opioid overdose.
She's got a lot more responsive than she was.
But Susan's breathing is still laboured and she appears confused. Kerry and the crews need to decide how to get her out and into the ambulance.
Right, are we thinking parachute? Do you want to get her on the sheet on the bed? If we roll her, pop it on, so slide under as much as we can, then roll her towards this way, pull it out, and then we can lower her to the floor, and then we can all just do a bit of sliding.
The slide sheets emergency teams use to move patients in tight spaces can carry people weighing up to 62 stone. Kerry coordinates the operation to get Susan out and onto the ambulance.
So if we try and concertina it from this end.
Sorry, Susan, sweetheart. Bend your legs for us, that's it, sweetheart.
Fantastic, well done.
Well done, darling.
To prevent her falling off, Susan's legs are placed in a large pocket at the bottom of the sheet.
Right then.
Susan is on the slide sheet, but getting her out and onto the ambulance is the team's next challenge.
You need to speak. Carry on speaking to us. Tell us what do you do? Where do you work? Just up the road. Doing what? Engineering. Okay.
Over in Dudley, critical care paramedic Faye Pollock is treating teenage motorcyclist Cameron following a collision with a car.
We've got everything at hand just in case we need to start helping him out with his breathing.
Cameron needs to be in hospital, but first Faye must realign his broken leg in order to ease his pain and to prevent a dangerous internal bleed.
We are all in position to give that a good pull. We're nearly ready, we're nearly ready.
Manual realignment is agonising, so Faye has given Cameron a strong painkiller and he is also taking gas and air.
Can you feel me touching you? Yeah?
The right one. Come on.
That's it, Cameron.
What's it called?
That's it, that's it.
Well done, you. Well done. Well done.
That's it, Cameron. It's done, mate. It's done.
Now the leg is straight, it needs to be kept in position.
That's it. Get ready with the pole. That's it. Yeah, pull the red now. Pull the red tab. Yeah, that's it.
Faye uses a traction frame to lock it in place.
That's it, that's it, that's it. Let's see how that is. Let's see his legs. Let's see his legs.
Well done. Well done.
Cameron, how is that feel? Is that feeling any better now?
Yeah, it feels better, yeah.
Okay, excellent. Well done, everyone. Cameron, what we're going to do is just going to roll you onto your poorly leg for just a second to get the stretcher under you. So it's only going to be for a few seconds.
Sorry, mate.
Fuck off.
Fine, we're under. Right, ready, set, roll.
That's better. That's it. That's it. It's done. It's done. It's done.
Have another suck on that, mate. Have another suck.
I know you feel absolutely rubbish at the moment, mate, but you're quite lucky that we're only dealing with your leg.
1, 2, 3.
Brilliant. We'll get you nice warmed up.
To avoid hypothermia, Cameron is wrapped in blankets and foil to keep in as much body heat as possible.
Perfect.
Looks like it's tensing up.
Now that we've straightened it up, all your muscles are all out of kilter, so it will start to spasm. 6-2, thank you.
Faye calls the trauma desk, who will inform the hospital to Cameron's arrival.
We're going to Russell's Hall, trauma tool positive stage 3, and our ETA now is probably about 5 minutes. We've alerted the hospital, so there'll be a couple of doctors waiting for us. Okay, good man. He was extremely lucky that he hasn't suffered more injuries. He could have bumped his head straight onto concrete and got himself a traumatic brain injury. I appreciate he's probably in a lot of discomfort at the moment with a broken leg. He really is perhaps the luckiest chap around today because it could have been far worse. We're here now, my sweet. All right.
Now as comfortable and stable as he can be, Faye can hand Cameron over to the waiting hospital doctors.
Just a few bumps, Cameron, okay?
Evening, I am here. I have drugs, so I'm just doing the checks, but you can use me if you need me, over.
It's Saturday night, and trauma doctor Matt Rowley and critical care paramedic Becky Chappell are beginning their shift.
We've had some really busy shifts together, but we've had some quieter shifts as well, so we'll see.
Years ago, everyone would say that Friday, Saturday nights are probably going to be your busiest nights of the week, but it can be a bit hit and miss. You can sometimes have busy weeknights, but historically, Friday, Saturday night will be busier. So I think as the night gets later on, we tend to see more things happening. Righto.
Ambulance service. Is the patient breathing?
Yes.
Are they conscious?
I don't think so. Well, my husband is falling down the stairs.
Okay. How old is he?
76.
We'll come with blue lights and sirens as fast as we can, okay?
A 76-year-old man unconscious after a stair fall is an immediate code red emergency, potentially requiring urgent critical care. So Becky and Dr. Matt are en route.
Worst case is if he has fallen top to bottom of the stairs, he could have a really significant brain injury, which has left him unconscious. If that's the case, we'll assess him when we get there, and potentially one of the things that we can do is to give him an anaesthetic and to put him into a medically induced coma.
In Britain, someone falls downstairs every 90 seconds, killing around 800 people a year.
Whether it's people that have slipped, whether they've had a medical event such as a heart attack or a stroke which has caused them to fall downstairs, whether they're intoxicated and fall downstairs, it definitely makes up a lot of our workload.
Becky and Dr. Matt arrived 16 minutes after their alert.
How you doing?
Hi,
You all
all right.
right? What we got?
Hello.
76-year-old Joe was on his way up to bed when he fell. His wife Sybil called 999.
Joe, can you stick your tongue out for me? Good man. Give my hand a squeeze. Joe, give my hand a squeeze for me.
Joe is barely responsive and his speech is slurred, which could indicate a brain trauma.
Do you know where you are at the moment? Where are you? Say again.
Yeah.
To properly assess him, Matt and Becky need to get Joe onto the ambulance.
Right, OK.
Okay, you're just walking down it.
Joe, just relax for her. Just relax,
Okay.
darling. Have you got pain in your head?
We're going to get you in the ambulance and have a little look at you. Get you warmed up first, yeah?
Give both of your feet a wiggle for me.
It's a good sign. But Joe needs a hospital scan to fully assess if there has been any damage to his spine.
Good, well done. Let's have a little feel of your chest. You got any pain anywhere, Joe?
Joe has no obvious serious injuries, but he's confused and his breathing is laboured.
He's definitely struggling, isn't he, from a respiratory point of view?
Brain trauma remains a risk. Becky seeks clues from his wife.
Does he take any blood thinners?
I think he does.
If somebody's taking blood thinners, they're at an increased risk of bleeding. So if they have bumped their head, been unconscious, they've got an obvious head injury, they are at risk of having a significant bleed into their head.
All right. Are you in pain, Joe?
I'm going to swap with you, so in 5 seconds, 4, 3, 2, 1. OK, jump out of the way, George. Nice one.
In a Wolverhampton Churchyard, critical care paramedic Stephen Mitchell is leading the resuscitation of a man found collapsed in cardiac arrest 22 minutes ago.
That looks like VF. Georgia, can you charge the monitor? OK. Everybody else stand clear, please. OK, everyone clear? Yeah. 5, 4, 3, 2, 1. OK. Right.
The man has now had 8 shocks from a defibrillator, but his heart has not gone back into a normal rhythm.
I'm going to get the Lucas device out. Open up the Lucas device over there for me, please.
Despite being very unstable, Mitch makes the decision to move the man to hospital.
OK, so mate, do you want to sort of go the other side and feed that under his back for me?
To keep blood pumping on the journey, he decides to use a Lucas device. Only carried by the critical care team, it performs automatic chest compressions.
We're going to place that underneath him, so I need you to lift his shoulder up for me. Sit him slightly forward, so Georgia, can you support his head? And then we'll put that underneath his armpit. Slight lift. Go on, put it through, Rich, that's it. Go for it. Yeah, push it on. OK, it's about to start, OK.
Lucas device fitted, Mitch can now move the man to the ambulance.
Right, what we'll do, guys, we're going to lift either side, watch everybody's toes, to speed the trolley in. Would you mind grabbing the foot end of the stretcher? Rich and myself, we're lifting the stretcher on 3. 1, 2, 3. Dan, push. OK, push. Sit. George, get the patient on the truck for me, please. OK, ready? OK, watch your back. OK, that's VF. Charge and shock that, yeah?
Everyone clear? Yeah. Shock in.
Before they move, Mitch gives the man another shock to try and get his heart back into a normal rhythm.
6-2.
6-2, go ahead, Mitch.
Mitch calls the critical care desk, who will update the nearest cardiac unit on the situation.
So, male, 30s to 40s. Currently, Lucas, he's had 9 shocks and he's in VF. He was found rather than witnessed. Received.
Yeah, thank you, Mitch.
Nice one, Rich, just nice and steady.
9 minutes later, Mitch delivers the man to hospital, with the Lucas device still maintaining blood flow round his body.
Yeah, you're happy there. Oh, slowly. Yeah, it's right. OK, got it. Oh. All right, cheers. His heart was in a disorganised rhythm throughout, and it needs shocking all the time or special drugs, so we brought him here where we can sort of take that a little bit further. And unfortunately, he's quite cold today, and whether that's been a factor to what's happened, we don't know.
You grab that bit and then... OK. Everyone ready? Are we going onto the floor now? Happy? Just gently, does it?
In Birmingham, critical care paramedic Kerry Hemus is leading the effort to get 62-year-old Susan onto the ambulance.
Ready, steady, move. I'm sorry, Susan.
Ready.
Everyone happy?
Yeah.
Lower. If we try and lift and slide at the same time, is that all right?
Susan, who has multiple sclerosis and is also overweight, is confused and having trouble breathing. Suspected of suffering from an accidental overdose of painkillers, she has been placed onto a slide sheet and taken off her bed. Kerry now needs to oversee getting her out of the house.
Ready, steady, slide. Is everyone happy? Ready, steady, slide. Perfect.
Sorry, Susan.
That's fine, darling, that's fine. Right, we've got a little bit of a lip here we're going to need to lift her over, so ready, steady, slide. Right, is everyone happy? OK, we'll just go... Yeah, well, we'll go up as far as we can, yeah? Everyone happy? Mind your back.
The most strenuous part of the procedure is lifting Susan onto the stretcher.
Right, ready, steady, lift. OK, just a bit, legs on first, that's fine, and then we'll readjust. Shall we stop a second, reposition? Yeah? When you're ready, yeah? Ready, steady, move. Beautiful. Right, let's get her in the warm and then we'll reassess. How are we doing, Susan? Okay.
Happy?
Yeah, happy.
Led by Kerry, but working as one, the paramedics start their transfer of Susan to hospital.
Yeah, slippery here as well. Oh, mind your foot. That's it.
Take you to hospital, Susan. All right, darling. Yeah.
With Susan's breathing still laboured,
There's a wheeze on the chest if you want to let them know.
Kerry travels with her in case she needs critical care. At the hospital, Susan's symptoms will be investigated further.
Right, I'll take this in with me. Her conscious level has come up and she started to respond. She's what we call aspirated, and that some of that vomit has gone on to her lungs, which is why she's wheezy. And now it's over to the hospital to try and make her better and sort her out.
Trauma doctor Richard Fawcett
GI gels is what it says on the tag.
and critical care paramedic Pete Edwards are preparing for their shift.
It's payday weekend, Friday night. Could expect anything. I'd be surprised if we don't go to a stabbing tonight, maybe an RTC, potentially somebody falling down the stairs. That's the sort of typical things, but it could go manic. Expect the unexpected.
Ambulance service for patient breathing.
Yeah, but it's really emergency. It's got stabbed, a massive wound, and it's bleeding, and I can't stop it. You can see his stomach.
Get a dry dressing or a clean cloth, fold it into a pad and press onto the wound. How old is he?
40.
Can you try and talk to me on the phone? Hello, sir. Where have you been stabbed?
In my belly.
Have you lost enough blood to fill a coffee mug?
Oh, there's blood everywhere.
A knife wound to the abdomen could be a Category 1 emergency. An ambulance is en route, and just as Pete predicted on payday Friday, so are he and Dr. Richard.
Got reports of a gentleman who's apparently been stabbed or slashed with a Stanley knife in a pub and has extricated himself home.
Now bleeding for over an hour, the volume of blood loss could become life-threatening. As Richard and Pete arrive at the house, our crew is asked to not film inside the property.
It's like a slash. No evidence of any major hemorrhage, and it looks like it's just in the fatty tissue.
The man's wound is superficial, and the local ambulance crew has stemmed the flow of blood loss.
We're going to just load him up and get him gone. 982 Whiskey Romeo over. They're going to take him to the QE. There's laceration to the torso.
The patient needs hospital treatment, but his injuries are not life-threatening. Richard and Pete leave him in the care of the ambulance crew. It's shaping up to be a typical Friday night for the critical care team as their second emergency comes through.
Ambulance service, how can I help?
Hello, it's West Midlands Police. Can I have an ambulance, please?
Yeah, what's the reason for us attending?
We've got an RTC. One person's been ejected from the vehicle, possibly in the stolen car. He's been at soup.
We're over there as soon as we can.
It's a road traffic collision with the potential for catastrophic, life-threatening injuries.
The details at the moment are all very sketchy and very limited. We're only about 3 minutes away, so I'm sure we'll find out soon enough.
Pete and Dr. Richard are the first medical team to arrive.
It's clipped the van, hasn't it?
Look at that. Is it this?
Fucking hell, they've ricocheted all down the road.
Police had been trying to stop a suspected stolen car, but the pursuit ended after the driver lost control, smashing into numerous vehicles on a residential street. An officer briefs Pete and Richard on the casualties.
Is it just the one patient, is it?
Yeah, well, we've got one in our police car there who was a passenger, but he's ran off and been caught in a foot chase. So our main concern is this guy here. He's been ejected from the rear and he was struggling to get up to begin with. We've managed to keep him as sedate as possible. So he's got some visible cuts on his eyebrows.
Hi, mate.
All right.
How you doing?
Fine.
All right, I'm Pete, one of the paramedics. Can I just have a quick feel of your wrist, mate?
Yeah.
Okay. Do you know what day it is?
Yeah.
What day is it?
Friday.
Let's just whip your top up, mate. Let's have a proper look at you.
The man is alert, ruling out a brain trauma, but Pete needs to assess him for other serious injuries.
You got no pins and needles or anything on you? All right.
When the ambulance crew arrives, Pete brings them up to speed as they prepare to take the man to hospital.
He's got facial injuries. The best thing to probably do is, if we just get the stretcher, we'll do all the observations and the checks in the vehicle. You say you haven't got any medical problems like asthma or diabetes? You've got a hole in your heart. So any breathing feel all right? All right.
A hole in the heart can weaken it, and the artery supplying blood to the lungs. Pete wants to get the man onto the ambulance to check if he has any internal injuries.
Can you feel me touching that? Yeah. Give me a squeeze. And this one? Yeah, all right, okay.
So let's sit him forward and have a quick gander at his back.
We're going to sit you forward so we can just have a look at your back a little bit and your chest, okay? We'll sit you forward, okay? If you come forward with me, that's it. I'll keep a hold of you.
In Stourbridge, 76-year-old Joe has fallen down the stairs at home.
There, we've got a bit of an abrasion there. Joe, is it hurting anywhere? I'm pushing here. Yes, whereabouts? Tell me when it hurts.
In your neck?
I mean, there's no crepitus, there's no instability, deformity or anything there. I think from a brain injury point of view, he seems okay. He's able to talk to us and he's alert. I think we're more concerned that he's got an underlying medical problem that's caused him to have a fall.
Just leave that on, Joe. That's helping your breathing.
His work of breathing is quite hard. His oxygen levels were low, so there's a concern that there's possibly an infection in his chest.
Despite being on oxygen, Joe is still struggling to breathe.
Shall I just go and speak to wife and see what it's been like in day with his breathing?
Yeah, okay.
Right, my stuff's there if you want.
Any information Joe's wife has could help determine their course of action.
Has he been struggling with his breathing today? Has he been like breathing quite quickly and looking a bit out of breath?
Yes, I noticed yesterday or the day before, he came downstairs and he couldn't get his breath, he was breathing, you know.
Right, OK, so he has been struggling today, but anyway,
yes.
OK. So he has been struggling quite a bit today with his breathing, quite out of breath coming down the stairs and such. So I think this is probably how he's been.
A lung infection, like pneumonia, could quickly become life-threatening. Joe needs urgent hospital care.
Do you want us to travel with you, all of us, or?
Yeah, if you don't mind.
Yeah, that's fine.
In case Joe's condition worsens, Becky stays on the ambulance, ready to provide life-saving treatment.
So was he initially unconscious, completely unconscious?
He was conscious throughout with us. His wife says that she's been conscious throughout with him.
Joe arrives at hospital, where any internal injuries and his difficulty breathing can be investigated further.
What we're going to do, we're going to get a stretcher here. Yeah. We're going to get you onto it, all right?
Yeah.
In Wolverhampton, critical care paramedic Pete Edwards and trauma doctor Richard Fawcett are on scene at a road traffic accident involving a suspected stolen car.
Don't move your head. Have you got any pain in your neck or anything?
A passenger who was thrown through the car's back window and onto the road hasn't moved since they arrived.
Okay. Definitely no pain in your legs, nothing? Sure, moving all right?
You can get up.
All right, okay.
Having found no evidence of serious injury, Pete decides it's safe for the man to stand up.
Okay, nice and steady. Just sit forward, right? Just nice and steady. No pains?
No, nothing.
All right then, mate. Come and sit on here then, yeah. Pop yourself on there. Swing your legs up.
further back.
It all seems to be facial injuries. You've been lucky, mate.
Incredibly, despite his ordeal, other than some cuts, the man appears unhurt.
He should have some major injuries, but actually, he's remarkably uninjured. Very lucky, extremely lucky. When you look up the street and see the damage to the cars, you'd expect some serious injuries, but yeah, nothing. Nothing major at least, anyway, which is a good thing.
It's 5 hours into Richard and Pete's Friday night shift.
On to the next.
And their third emergency call is coming through.
Ambulance service, can I help you? Hi, can we request your attendance, please? Yeah, are they conscious and breathing? We've got a vehicle that's gone into a wall. I think there's a number of people in the vehicle, not just one. What's the vehicle hit, sorry? It's hit a wall. We're currently requesting fire as well, because it sounds like potentially they're stuck in the vehicle. They're trying to get the female out of the rear, and she's screaming in pain. The engine has come out of the vehicle, so it's going to be very high impact. I'd be surprised if there wasn't any injuries.
Sounds like there's maybe people trapped inside the car, so either they've sustained serious injuries and they can't actually get themselves out because they've got broken bones, etc., or the impact of the crash has caused the metalwork to crumple and physically trap the patient inside, or a combination of both.
It's another typical post-midnight road traffic accident, and all 3 emergency services have been called to the scene.
From both ends of High Street.
Firefighters are trying to free a trapped passenger. The operational manager briefs Richard.
Female still in the back. She's got apparently some neck pain. The driver apparently has walked off, so unknown where he is at present, and they're not being very au fait of who he is and where he is.
The car has come around a bend, veered off the road and hit a stone wall.
A heck of a whack, isn't it?
Yeah.
The high-impact crash demolished the front of the vehicle, dislodging its engine and throwing it clear. The driver has disappeared, and the woman left trapped inside has just been freed, so Richard can assess her. She's traumatized and in pain, but Richard's satisfied the woman has no life-threatening injuries. It's the second remarkably unscathed passenger involved in a major car crash that Richard and Pete have had on their Friday night shift.
Not really got any apparent obvious significant injuries. It's just complaining of some neck and back pain over.
Fortunately for this individual, they can leave her in the care of the ambulance crew, who will take her to the nearest hospital.
It's quite a lot of damage to the front of the car, but actually the crumple zones have absorbed all the energy, and the actual part of the car where the passengers were sitting is actually undamaged. So they've got away with it really, done really well. It's got a shoulder injury, but otherwise seems uninjured with what could have been. She's got off lightly, so we're not required. Ambulance crew more than capable and happy to deal with that.
As Pete predicted, it's been a busy payday night shift for the critical care team.
We've done the stabbing, 2 RTCs, which is a pretty regular weekend night.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate. I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
Got an ETA at all to get him out?
It's going to be a minimum of 5.
emergency teams battle to free an injured driver.
I believe his legs are trapped by the pedals and twisted round.
DIY disaster after a pensioner falls off his roof.
You can't fall any further, Henry.
Medics fight to save the life of a cyclist.
Basically, he's got a thoracic brain injury. He is still breathing a bit. That is still him.
And multiple calls reporting a shooting.
There's a gunshot. You need to bring an ambulance now. Oh my God.
Yeah, but just from a... Just if we get another job on the way back, these hoods both got batteries, both clean to go. Back to base.
At base, Dr. Polly Haywood and critical care paramedic Sarah Foley are checking in for the night shift.
Right, we've got Rocurone in there, we've got fentanyl there, and we've got ketamine there. So they're drawn up, they're not used.
Dr. Polly spends half her time in hospital as an emergency department consultant
I feel like Tyrone Curry, actually.
and half on the road, responding to life-threatening trauma.
On the fentanyl, you've got the fentanyl vial, and we've got 3. Perfect.
Sarah is a full-time critical care paramedic, working shifts day and night.
There you go. Is it coffee time?
Ambulance service, is the patient breathing?
Westminster Police, can you join us at RTC, please?
Yeah, that's absolutely fine. Is the patient male or female?
Adult male. He's still stuck in the car that he's crashed into a wall. So we're on to fire to get them to cut him out.
Right, okay.
I've got no idea on his injuries because we can't get into them.
Right, he's stuck in the car.
Yeah.
It's a major crash. Police, fire and ambulance are already at the scene. Now they've requested specialist trauma backup. Polly and Sarah are immediately dispatched.
Go ahead.
Patient is still trapped in the car with no change in his condition.
Thank you, Grant. We're going to be 3 minutes.
The driver has been trapped for over half an hour and the full extent of his injuries is still unknown.
Trauma desk, this is Mike Delta 98, on scene. Oh, there's quite a lot of debris here, careful.
Evidence of a major impact is strewn down the street.
Where taking out some railings.
And
there.
we've got the car just there.
The car has spun out of control, demolished a wall before flipping sideways onto a driveway. Firefighters are still working to free the driver.
Got an ETA from the fire to get him out.
It's been delayed every time. Just try one thing and it's not working.
Polly and Sarah are briefed by the ambulance crew so they can now lead the critical care.
I believe his legs are trapped by the pedals and twisted round.
can't assess his injuries at the bottom because it slipped through the wheels, nobody the mangled round him.
In the smash, the engine has shunted back, trapping the driver from his abdomen. But it's too dangerous for Polly or Sarah to approach him.
But all I know is that it's lower back pain, so we might have to ked him because I can't do anything until them legs are free.
The Midland Air Ambulance charity covers a region of 6 counties, one of the largest operating areas in the UK.
Element 03 Alpha's road stop recall.
As well as 3 helicopters, the charity also supports the daytime critical care cars in cities and built-up areas, where it's more difficult for an aircraft to operate.
Mike Delta 98.
No, mate, you're not too far from this. I think about 4 minutes. RTC motorcycle v car.
That's lovely. Thanks, Steve. We'll go and have a look.
Critical care paramedic Colin has been working for the service for the last 12 years.
You get to patients a bit quicker on the car in terms of the ones in the urban areas. You can make a real difference getting there quick and intervening in certain ways. It always seems to be busy when it's hot for some reason. I guess people are just more inclined to get out and about and do things and maybe do stuff they wouldn't normally do.
Experience suggests his life-saving skills will be in demand today.
Ambulance service, is the patient breathing?
I don't know. It's just fell off the roof.
Okay, how old is the patient?
81.
Are you with him at the moment?
I'm with him. It's fell smack on his face, on his tummy.
Can you check if he's conscious and awake for me?
Are you awake, love? No, he's not answering.
Okay, are you breathing in and out normally?
No, it's not.
I've got help coming to you as quick as they can, okay?
An ambulance has been dispatched, but with the possibilities of a fractured skull and internal bleeding, the advanced clinical expertise of critical care paramedic Colin is also urgently needed.
So we're going to an 81-year-old male who was fallen off a roof. I think it was reported that he was unconscious, so that's where we're heading at the minute. And it's very close, actually, so we might actually be on scene first. 6-2, go ahead.
63 Colin, talk group 80, please. But yeah, talk group 80, thanks.
Falling from height is the biggest cause of death for people tackling DIY. Every week, someone is killed falling off a ladder. Fortunately, the address is just minutes from base, and Colin is first on scene.
What's his name?
Henry.
Hello, Henry.
Hello.
My name's Colin. Can you hear me all right?
Yep.
All right, do you remember falling off the roof?
I haven't fallen off the roof.
Where have you fallen from, the ladder? Do you know where you are? Just keep your head nice and still for a minute, and we'll see what's going on with you, all right? You've obviously fallen and hit your head quite hard.
Henry, a retired teacher, was checking for leaks on his roof when he fell onto the concrete drive. His wife Patsy was at home and called 999.
Put his foot on the first one and he slipped.
Okay.
A local ambulance crew has arrived to help.
So he is conscious, he's maintained his own airway, he's got a strong radial pulse. I think the plan will be is that we'll mobilise him on a scoop, get him up off the floor, and then we can give him an assessment in the back of the ambulance.
As well as a significant head wound, Colin's also concerned Henry has suffered internal injuries. And any medication he's taking could make bleeding significantly worse.
Is he on any blood thinners? No, not blood thinners. He's on blood pressure tablets.
All right.
I've got his medicine. I'll get everything for you.
What's your wife's name?
Patsy.
Patsy, he's okay. Okay, he's fully conscious. Just relax. Go and just calm yourself down because we're going to look after him and he'll be fine. There's no need to rush around and get yourself all worked up. He's going to go to the hospital for a checkup and some assessment, but he'll be okay.
Colin must keep Patsy calm. He needs to concentrate on Henry's trauma.
I'm just wondering, once the roof was off, how are we still lifting that engine block of his legs?
It's 3:30 in the morning, and Dr. Polly and critical care paramedic Sarah are waiting to assess a driver trapped after a serious crash.
Can I just get, Canada in and stuff like that?
They won't let me do anything just yet. They've got a spreader holding the actual car apart at the moment.
Right.
So it's quite dangerous. The front end is really sort of
unstable.
Okay.
Miraculously, despite the high impact, the driver is alive and conscious.
Got an ETA at all to get him out? Sorry.
It's going to be a minimum of 5.
Rescuing the injured in these difficult environments relies on tight teamwork between all the emergency services.
In terms of stability and access to the patient clinically, can we work through this space at all to put a cannula in?
We won't round you if you need to.
Yeah.
Obviously, we're going to cut this now. We're going to get a lot more space. We're going to roof off.
Yeah.
Polly needs to make the operational commander aware that the driver's condition may suddenly become life-threatening.
So essentially, from a clinical point of view, 40 minutes plus, having that engine block in your legs is a bit like having a tourniquet on.
Yeah.
As you release it, you're going to just dump loads of stuff, and that's the point at which he doesn't look so good.
Using hydraulic jaws of life cutters, the firefighters begin taking the car apart.
My lovely, I'm going to give you something for the pain, all right?
An hour after the crash, and with the roof now off, Polly and Sarah can safely treat their patient.
It's paracetamol to start with, but into a vein, so it's stronger than normal. And then we're going to give you some morphine. Have you had morphine before?
Right. Position now, where we can release legs.
Hey, they're going to move the dashboard off your legs now, okay?
Very reassuring.
We've got a long board ready.
Having given the man pain relief, the team prepare to get him out.
Just going to have a look. Is that all right, mate? No, you're right. Even if you can't move it much, can you wiggle your toes inside your shoes, okay?
There's no blood around, so I'm happy that we're not bleeding and we can go.
Yeah. Okay.
Okay. Going well. Nice and steady.
Right, just wait a minute. He's got his legs very, very spread. Think about his pelvis. Sarah, has he got any pelvic pain? His legs are a real kimbo.
Before moving him, Polly wants to be sure he doesn't have a broken pelvis. This could cause a catastrophic hemorrhage.
Sweetheart, is there any pain in your middle by your hips?
No.
No, thank you. Can you come out now?
You can come out now if you're happy enough. There's no broken legs.
We need him out.
Polly stays alongside the man in case his condition suddenly deteriorates when they move him.
All right, mate, you're doing okay. All right, buddy, I know it's horrid. You're doing all right. You need to open your eyes for me, pal. That's it, good man. I know it's a horrid situation. Sweetheart, have you got any pain across your hips? In your back, in your lower back? Okay, from the middle. We're just trying to get some space to get you out, pal, okay?
Stay sitting forward as much as you can.
There's a hard board in behind you, okay? Yeah, of course we're going to be careful, pal.
Got enough people?
We'll take him to here.
Yeah.
That's it, well done, you're out, buddy. Okay, and down, and down. All right, matey.
Brilliant. Thank you, guys. That was brilliant.
All right.
It's taken a team of 21 highly trained emergency workers 72 minutes to get the driver out of the car.
Can you raise this leg for us?
Good man.
Yeah, that's fine.
Okay, no, his pelvis.
No, so his pelvis is fine, intact. To be honest, Colin,
Confident the driver has no immediate life-threatening injuries, the team prepare to move him onto the ambulance.
okay, on your call at the head end, okay?
Okay, go.
And down.
Great.
Right, Delta 98, thank you. Patient is now being loaded onto the back of the ambulance.
While Sarah updates the trauma desk,
We're just going to do a top-to-toe assessment so that we can work out which hospital this is going to go to, is it?
I know your chest hurts to breathe, okay?
Polly assesses the level of the man's injuries.
We're going to bandage your leg, we're going to get you to hospital. All right, mate?
It's clear there is internal trauma. He needs an urgent scan. Holly and Sarah travel with him to the Queen Elizabeth Hospital, Birmingham, where he's handed over to the waiting doctors for emergency care.
What were you doing, Henry? What had you gone up the ladder for?
In Oldbury, critical care paramedic Colin is treating 81-year-old Henry, who has a serious head injury after falling off his roof.
Am I on the roof?
You're on the floor of the mountain,
definitely on the floor. You can't fall any further, Henry.
Henry suddenly seems confused, a worrying sign his brain is not working as it should.
Okay. Ready, lift.
His brain may be swelling and pushing against his skull, reducing the vital flow of oxygen-rich blood.
So she's put the ladder away, but he was up at this top of the guttering bit, and it sounds like he's just missed his footing on the ladder and fallen. The ladder stayed where it was, and he just fell down to the floor. So quite a fall for his age.
Can that follow with my card off so I know where you've gone? Assess your needs.
They won't let you in the hospital when we get there.
But how will I know where it is?
So what we'll do is we'll take your details,
Alright,
this
darling?
next kit, and someone will call you from the hospital, okay?
Okay, I'll come back.
COVID restrictions mean that Henry's wife Patsy can't go to hospital with him.
We just got him in the back of the ambulance. We're going to do a set of observations. He's obviously elderly, and he's had a decent fall, and he's lost consciousness, so that's a concern. We need to go to hospital with an alert so they can get him assessed and scanned, if possible, quickly if he needs it. It depends on his condition when he gets there. Just have a feel of his chest for me. Just have a feel all round this, because you check, I know you listen, just have a feel all round, just check for any fall. Does it hurt anywhere where we press on your chest?
As well as damage to his brain, Colin is concerned the impact of the fall may also have injured Henry's lungs.
Henry, do you have any pain in your tummy?
A blow to the chest can cause fluid to build up, which has life-threatening consequences.
And with your legs, can you move your legs for me? Turn that one. Can you feel me touching all the way down your legs? Yes.
Any pain in your chest at all?
No.
Listen.
No, that's all right. You just look a bit red in the face.
After masking up, Patsy is allowed onto the ambulance to say goodbye, while Colin updates the trauma desk.
He's impacted the ground with the right side of his head, where he's got a large swelling and laceration above his eye and around his right zygoma. He also might have a broken nose. He's got no neck or back pain. He's got no chest pain. His chest all seems fine on examination. He's not 100% sure exactly what's happened.
To let you know, we're going to stand.
Colin is happy Henry is stable enough to be left with the ambulance crew for the 10-minute journey to the nearest trauma centre.
They will assess his whole body. They'll make sure he's not got any injuries they haven't missed. They'll monitor his observations for a good while. They might even keep him in overnight. They might keep him in longer than that. He'll be in A&E initially, and then he'll probably be moved to a ward. So just try not to... As he is at the moment, he seems like he's recovering well. He should make a good recovery, how he seems at the moment, all right?
Thank you very much indeed for all your help.
All right, you take care.
Sorry about this.
No, you don't be sorry. We just hope he's all right, so all the best. His risk factor is his age, and that's why he's going to the trauma unit, where they can give him a rapid assessment to make sure that he's not going to deteriorate. You know, he's 81, he's fallen off a ladder. There's plenty of 20-year-olds that have fallen off ladders, so yeah, he's just got to be careful. But I should think he'll be able to get back to his DIY soon.
Hello, I'm the ambulance service. Is the patient breathing?
Is he breathing? Is he breathing?
Yeah, is he conscious and awake?
He's bleeding really badly. Hello? Can you have an ambulance quickly? Sorry, I'm a nurse.
The patient's not fully conscious at the moment.
He's breathing but not fully conscious.
Okay, just explain to me briefly what happened.
He was on a cycle and he's gone over at the junction and a car's hit him.
It's the highest priority, so over there as soon as we can.
We have a cyclist instructed
An ambulance has been dispatched, but there's a high chance the cyclist has a significant head injury.
Police room attendant shutting the road off. There's no danger to the crew. Don't require any other resources if necessary.
Critical care paramedics Aidan Brown and Ryan Ferris have been scrambled.
The initial reports have came through that he's unconscious and having a seizure. Likelihood that he could be a very unwell gentleman with quite a significant head injury.
Reports of the cyclist's condition is so serious, a trauma doctor has also been dispatched.
We've got a run time of 1 minute.
When they arrive, police and paramedics are already on scene.
Hello, good morning, good morning. Hi, I'm Ryan, one of the CCPs.
Hi, bud. You're a cyclist. He's very irritable now. He's got a nasty wound.
Was there any sort of active seizure activity on your arrival?
Yes, he's fitted.
He's fitted, has he?
I need you to sit still, darling.
All right, sir.
Try and relax for us. We've got you.
The 22-year-old cyclist was on his way to work when he crossed a busy junction and was hit by an oncoming car. The force of the impact threw him into the windscreen and he landed on the road.
Has he got a blow-in pupil?
No.
No, that's fine.
He wasn't wearing a helmet.
Eyes 1, voice 2, motor 5, so we'll give him a GCS of 8 with a high motor score.
Ryan's initial examination indicates an extremely reduced level of consciousness and a life-threatening brain injury.
Significant right-sided head injury.
Yeah.
But he has got a high motor score. No overapparent injuries, moving all limbs independently. Just very agitated.
Although unconscious, he's fitting and at risk of making the injury worse.
If you're happy, I think what we'll do, we'll sedate him a bit, get him relaxed. Yeah. We'll get him scooped onto the stretcher and we'll potentially just prepare in case he needs an anaesthetic and we'll get him off to sleep.
Aidan quickly prepares ketamine, a drug carried especially by the critical care team to calm him down.
I'll go 30 milligram potentially initially, just to try and get him relaxed.
Okay. Just hold that still for us, mate. Sorry. Let's just get a monitor. We've got the monitor there. Ryan, are you happy with the primary survey?
Sorry, primary survey-wise, yes.
Yeah.
Chest moving equally.
Yeah.
We've seen him move all his limbs.
Yeah.
He's both straight leg raised independently.
Okay, cool.
We'll just sort of talk to him, all right, because with the ketamine, he's going to have a bit of a strange sort of experience, okay?
The man is so seriously injured, he needs to be put into a coma. But there must also be a trauma doctor present to administer the anaesthetic.
I'll tell you what, let's get a bandage over that cannula as well. That's fine. All right, guys. This gentleman's going to go up to sleep. Okay, so just to make you aware, we're going to just prep, get him on there, and then we're going to give him an anaesthetic and set him off to sleep. All right.
So he's got a traumatic brain injury. Is significantly agitated with a low GCS. So we're just waiting for the Helimed's medic crew with a doctor on board, and the plan is to take over his breathing, and then he'll be going to a major trauma centre. You stay with the patient, man. Make sure we've got a full assessment.
Yeah.
I'll set up for an RSI here. Okay?
Yeah, that's fine.
While they wait for the doctor, Ryan and Aidan prep for the complex procedure, one that's normally only carried out in hospital.
So what we'll do, the obs are on. We'll get that on a 3-minute cycle, if you don't mind, please.
The cyclist is still in a very unstable and agitated state.
Have you got the ketamine still?
Yeah.
His blood pressure's fine. He's starting to fight us a bit more. Are you happy if I go for another 20?
Yeah.
Guys, just going to give him a little bit more ketamine, all right, just to relax him.
Thank you. Have you got a rough ETA, please?
Aidan checks the ETA of the doctor.
Just for your information, the patient is packaged on a scoop. We are fully prepped for an RSI, so we're ready on your arrival or received.
Any delay could be fatal.
Thank you. 7064-203 over. The patient appears to have a traumatic brain injury, significantly reduced GCS and agitation.
Okay, everybody happy?
Right, okay, guys, so I'll take over from here. So we need 2 people going to do an RSI, so it's going to anaesthetise him, okay? The doctor's just a few minutes away.
A trauma doctor is en route, while the team at the scene prepare to put the critically ill man into a coma. This should reduce swelling and prevent any further brain damage.
So just pop that out the way, if that's okay, mate. Okay, so hopefully we'll get that reading in a second. And we should have everything pretty much good to go. That's okay, I've got it here, yeah. Yeah, so we'll just wait until we get some end tidal. That suction's all good to go. So observations are okay. We're in a good position in that sense. So as soon as we get some more ketamine, it'll stay a bit flatter and we can prep for the RSI.
Managing the patient's airway during the procedure carries a high risk of COVID transmission, so the critical care team must wear level 3 protective suits.
Okay, I'm going to take over this, okay?
Okay.
Thank you.
Okay.
Okay, are you happy?
Happy, thank you.
I'm going to go and get level 3, Ryan.
Yep.
So everything else should be good to go.
With everything now prepped, a second critical care car arrives with a trauma doctor on board. Aidan quickly briefs him.
It's been quite agitated, so it's had some ketamine. Everything's ready, including the drugs.
Yeah.
So pretty much, as long as you make a quick assessment, whatever.
Yeah,
it's
he's
good
on
to
this
go.
one now.
All right.
Dr. Jake Turner can now oversee the life-saving intervention.
Okay, guys, I'm going to go through a checklist, all right?
Okay.
So oxygen supply,
Oxygen.
end tidal, BVM, suction,
Working.
on and working, ECG, and ketamine. He has had 100 milligrams already, so now there's 100 left in there.
The doctor now administers the drugs that will temporarily shut down brain function.
Yeah, feels fine to ventilate. He is still breathing a bit. That is still him.
We're happy at the moment. Happy with the air.
Happy, he's still saturating fine.
Okay, I think we have apnea now. On the ventilator.
At the point where the man is paralysed and no longer able to breathe for himself, Ryan must insert a breathing tube down into his lungs.
Okay, right.
Thank you.
Suction is here.
Cheers. Got it. Okay, got a grade 2 view, please. Of the bougie.
You have the bougie.
Thank you.
He has just 5 minutes to start ventilating, otherwise he could die.
Hang on.
And the
I have the bougie.
Bougie through the cords, that's 23 centimetres at the teeth.
Okay, Ryan, you want to hold left hand, right hand?
Left hand, please.
Happy with this?
Happy, thank you. Thank you for that,
I'll
Aidan.
sort the vents inside, shall I?
The team have successfully anaesthetised their patient and taken over his breathing.
Okay, so end tidal 6, I'm just going to bag a little bit more, bring it down.
Okay, guys, vent is set up inside, ready to go.
He's now ready to be taken to the nearest major trauma centre.
So, happy, he's on about 480 volume. You happy to bring his rate up slightly?
Yeah.
Just with that end tidal.
6-2, thank you. Atmos when you're ready.
Aidan puts in a call to alert them of his arrival.
Thank you. Approximately 20-year-old male, traumatic brain injury, treatment given. He's had TXA. He's had an RSI with rocuronium and ketamine. ETA to the QE is 12 minutes from now.
Ryan and Dr. Jake travel with the man to provide continuous critical care throughout the journey.
GCS initially, eyes 1, voice 2, motor 5, GCS 8. So we had a high motor score.
The paralysing effect of the anaesthetic lasts for less than 30 minutes, so they have to constantly monitor to avoid any conflict between the patient's natural breathing and the ventilator.
If we can take that further down on his legs almost. Happy?
Arriving at the Queen Elizabeth Hospital, Birmingham,
Thank you. Can I pass you that?
the critically ill man is taken directly to the emergency doctors.
Initially, with the impact and the head injury, the patient can present a lot worse than the injury actually is because of the initial impact to the brain, the swelling, the bruising. So we won't really know anything until he gets a CT scan. And even then, it may be a few days he remains in an induced coma whilst the brain recovers. And he may have a very positive outcome. Unfortunately, he appeared to be a very unwell gentleman at the scene, so I can only hope that he makes a positive outcome.
Ambulance service. Is the patient breathing? Can I have an ambulance? Is the patient breathing?
I don't know if the patient's breathing. There's been a gunshot. There's a gunshot. You need to bring an ambulance now. Oh my God.
What's he just?
No, I don't have his name. It's near like a field. There's another call coming through. Yeah, I've got it. Black Patch Park. Yeah. Did she say what had happened? Gunshot.
Every year in England, around 30 people die and over 160 are injured in shootings. With the possibility of a major incident, the police firearms unit has been dispatched. And so too have the critical care team of Dr. Ravi Chauhan and critical care paramedic Richard Apps.
The information is a bit sketchy. It sounds like the call might have come from the firearms unit saying that shots have been fired, but that's the only information they've got. Then there's lots of other calls that are apparently coming in, but we haven't really got any information on patients at the moment.
So that's firearms that have just gone
flying past us.
Emergency teams are racing to the incident, but in dangerous cases like shootings, ambulance crews and the critical care team meet at a rendezvous point until police make the scene safe.
I'm just going to ask him what's occurring.
Operations manager Jason Lowe is also on scene.
Right, so...
Have we got patient info at all?
Someone I got when I first got the job has been shot in the head.
Sam.
One crew member from that vehicle can drive this one in, so if they are any arrests, we can go and take it.
Yeah.
All right.
Yeah.
I'll
Sam.
just have a chat with Greg on the 17th.
Yeah.
The medical team need to change into full PPE as resuscitation of the gunshot victim sounds likely.
I will put a Tyvek suit on just in case, but not my respirator, obviously. Because it's a reported shot to the head. So if we do go forward, good potential that it'll be an arrest.
While police search for the gunman and casualties, all Richard and Ravi can do is wait. The critical care team in the West Midlands operate 24/7.
We're on the way to someone who's been stabbed in the neck.
At night, when the air ambulance doesn't fly, a doctor joins the fast response cars.
Look at me. I'm going to get you onto the ambulance, OK?
Tonight, Dr. Matt Rowley is on shift with critical care paramedic Jack Lewis.
Good evening, Grant. We're just going to get some caffeine, mate. Obviously, all checked available and waiting for your call.
Hello, mate. There is literally a job that's come in for medic requests, if you are good to go.
Yeah, send it through.
Hello, you're speaking to the ambulance service at the main end. Somebody's had a car crash. It's completely fucked. Okay, how many cars are involved? He's lost control in his tree. Okay. His cars are right up. Can you see whether they are breathing? They're not breathing, but he's out of it. Is he responding to anybody? No.
There's reports of a car into a tree, not very far away from us. Potentially multiple patients, one unconscious, we believe. We've got multiple resources en route.
On average, 5 people die every day on Britain's roads, with countless more seriously injured. Jack and Matt's enhanced life-saving skills are urgently needed.
Quick update from scene. Conscious male patient at the present, bleeding from the abdomen. Got to pacify extreme damage to the car. Update you further shortly.
So, multiple patients, sounds like we've got at least 2, and a male. Sounds like they're still in the vehicle with a bleeding abdomen. I think this gentleman's got potential to be unwell.
On their arrival, police and ambulance are already on scene. One patient, the driver, has just been released from the car.
If you're happy, just continue to the back of the truck and we'll meet you on there. I'll take a look at the car. All right.
He was conscious when the passerby got to him, and they pulled him out of the car, placed him in the recovery position.
The operational commander briefs Matt on the incident.
He's jumped a fair way up that tree, hasn't he?
He really has. So it is a fair way up, and there is quite a bit of passenger space intrusion.
Yeah.
They did pull him from the driver's seat, so his side was quite free.
Right, cool. How are we doing?
With the driver now on the ambulance, Matt begins assessing the extent of his injuries.
Can you give my hand a squeeze for me? Good. Can you stick your tongue out for me? Stick your tongue out. Roughly, yeah. Squeeze this hand.
20-year-old Khalil, a restaurant cashier, was driving home from work when he lost control and crashed into the tree.
So unconscious with passerby then, he pulled him out, but then like this with you guys when you got here?
Yeah. If he's got there, eyes were closed.
Yeah.
As soon as he moved at all, that open eyes, tracking me, with no response at all.
Khalil is agitated, but not responding to any commands.
Sit still for me, alright?
Keep your head down. Good man. Alright.
What have you on?
Alright, try to keep your head down. Good man. Alright.
Jack inspects the car to get a better insight into what injuries Khalil may have sustained.
So significant passenger space intrusion. Driver space looks all right.
The windscreen has a clear imprint where Khalil's head smashed into it.
So he's clearly been unrestrained.
Jack updates the trauma desk.
Airbags have been deployed and it's clear that the seatbelt was not being worn. It's still fastened, so he's been sat on it by the looks of things.
All the indications are Khalil has sustained a life-threatening head trauma.
I haven't got you a full GCS breakdown, but it's safe to say he's not a GCS 15. It will probably either be the QE. We're just getting him on the back of the vehicle and sorted out. We'll come back to you with some obs and a plan shortly. Not behaving normally. We're going to sedate him slightly, but it might be that that escalates to a full anaesthetic. But I'll come back to you with full details in a little bit. Received. Just relax, mate. Just lie back.
Yeah.
Lie back.
For me, all right? Keep your head down for me. Good man.
9660. You want to just snapshot that for us?
We've got BM5.
BM5, cool.
You can see from the vehicle that all the impacts have been taken on the passenger side, which is probably the only reason he's still alive. Although he's not been wearing his seatbelt, so he's clearly been thrown around in the vehicle. We can't see anything obvious in terms of fractures or huge wounds, but his behaviour is certainly not normal. Potentially consistent with a head injury, like a closed head injury. So our first step is we're going to just give him a little bit of sedation so that we can assess him properly and calm him slightly. And then if needs be, it might be that becomes a full anaesthetic, but he's certainly gone through a significant mechanism of injury there.
So we're going to give him a bit of ketamine, just see if we can get him chilled out a bit.
Yeah. Okay.
If we can't get adequate control with some ketamine, we can put him off to sleep.
Sit still for me. Good man.
You smell any alcohol at the top end? Maybe. No.
While giving the ketamine sedative, Matt and Jack discuss his coma scale assessment.
So GCS-wise, we are probably an E3, V1, motor, and then 5 probably, to localise.
Khalil's score is on the border between moderate and severe brain injury.
Is that a fair impact?
Oh, it's massive.
Enough to shake his head around. Can you give my hand a squeeze for me? Just squeeze my hand. Good. So yeah, he obeys commands. So if you're happy, I think we just go. Airway-wise, he's all right, isn't he? He's oxygenating, he's ventilating well. As you said, whether he's a bit shook up because he's had his brain rolled around his head, I think if you're in agreement, I don't think we should RSI him at the moment and just...
His airway's very patent, it's not maintained.
Just a little bit of ketamine if he gets unmanageable again, and 20 seems to have worked the trick.
Yep, sounds good to me.
After assessing him, Matt and Jack don't think a full anaesthetic is needed.
Up to the QE.
The ketamine has relaxed Khalil, enough to ensure he's safe to travel to hospital.
60.
Yeah, go ahead.
Jack updates the trauma desk, who will alert the Queen Elizabeth Hospital, Birmingham.
We can't find any obvious kind of musculoskeletal injuries. There's no abdominal guarding, chest seems clear, and nothing to the head. So a small amount of ketamine sedation, but doesn't require anything further from us. So we're going to be escorting to the QE with an approximate ETA of probably about 20 minutes. So.
Yep, that is all received. I'll give them a shout for you.
Khalil is still in a life-threatening condition. so both Jack and Matt stay on the ambulance to closely monitor him, ready to intervene on the journey if necessary.
Can you give my hand a squeeze for me? Good. All right, well done.
He will open his eyes across.
Yeah. So we're going to take him into resus at Queen Elizabeth Hospital. He'll get assessed by their trauma team. They'll reassess his airway, breathing, circulation, and then he'll probably need to go for a CT scan of his head and any other bits of his body that the team feel appropriate when they have a look at him.
At the Queen Elizabeth, the critical care team hand Khalil over to the trauma doctors for the next stage of his emergency care.
It's a massive impact, massive mechanism. Even we don't see that type of mechanism that regularly. And although we go to a lot of RTCs, generally if people are wearing their seatbelts, they generally do okay. But as soon as people stop wearing their seatbelts, those are the ones that tend to come across our door a little bit because they generally have more significant trauma, more significant injuries that require our support. Anyone involved in that type of incident is lucky to be alive. You know, if the car had hit the tree on the other side, then, you know, he probably would, you know, that would have probably been a fatality.
Just go on and rescue him.
Ravi and Richard are in Smethwick, responding to multiple calls reporting a shooting. Police have been searching the area for the last 20 minutes.
There is evidence of a party, but there's no sign of any shooting, no sign of any patients, no sign of any disturbance.
It could be a malicious call, but the emergency team need to be sure no one's in need of their help.
Try and get us cleared.
They've gone into the suite room, there's nothing there. So I took on the phone and say they need to go into the suite room.
It does sound like it's going to turn out to be a hoax. Or, if not a hoax, a misunderstanding or misheard gunshot. So we'll, at the moment, I think we're going to stand by with the first crew, but we may get stood down ourselves shortly.
Another search of the area uncovers nothing. It's a frustrating but not uncommon false alarm.
So the firearms unit, they've probably got a few of them roaming around, and then obviously, yeah, we've got 2 crews, 2 officers and ourselves here, so yeah, it's quite a lot of resource for these kind of things. Fortunately, lots of them don't turn out to be anything. The majority don't, so, which is a good thing.
In the 25 minutes Ravi and Richard have been on scene, West Midlands Ambulance Service have received 70 genuine emergency calls. In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
Accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
just need to check.
to stabbings.
You can put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
Oh no, mate. Oh no, we're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, 2 lives are in danger after a double stabbing.
Life-threatening, potentially life-changing.
His ankle is off by his head.
A pedestrian is run over by a bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Matthew, open your eyes.
A driver collapses after a high-speed crash.
He's just not responding to pain. We're going to put him to sleep.
Can you hear it going on?
And a man is left battling for life after a city centre fight.
Seven 7062.
7062, good morning.
7062, good morning. I'm here. You can book me on here all day.
It's the start of a 12-hour shift for critical care paramedic Jack Lewis.
I am relatively apprehensive about what we're going to get today. I was on the trauma desk yesterday, very, very busy. This car particularly, with a range of stuff from quite nasty trauma to some unfortunate medical incidents. I think we're going to be the same today.
Ambulance services to patient breathing.
He's just been stabbed.
Okay, what have they been stabbed with, do you know?
A knife.
Okay, are they bleeding heavily?
Yes.
And how old are they?
But adult.
Do you know where the stab wounds are?
One's got one in the stomach, one's in the chest, and one's in the stomach. The one's got 2 stab wounds, losing consciousness.
Are you if he's lost about 2 mugfuls of blood?
It's close to.
Okay.
Can you just send an ambulance,
Yeah,
please?
it's not delaying any help, sir, okay.
62 Whiskey Romeo.
A stabbing is one of the most challenging situations a critical care specialist can face. If an artery has been severed, a patient can bleed to death in minutes.
Been deployed to reports of a double stabbing, 2 patients, one with chest injuries, one with chest and abdominal injuries in a park not too far from the QE, so hopefully it'll be a case of a rapid assessment, major hemorrhage or like, you know, life threat control, and then a rapid extrication. 60, thank you. ETA approximately 3 to 4 minutes.
The critical care team in the West Midlands deal with more than 30 stabbings every week. Reducing the number of deaths is one of the service's main objectives.
Police en route. So you'll be first on scene.
Roger, that's all copied.
We are having updates to scene with these patients are unconscious. Police today, their ETA was 2 minutes.
Roger, given the severity of their potential condition, I am happy to make scene with a dynamic risk assessment received.
With 2 patients' lives on the line, every second counts.
Updated report from police has come through that they're both unconscious, so potentially this is going to be 2 traumatic cardiac arrests.
7062, did you receive over?
60, that's all copied, just pulling up behind 4634 and has Romeo 55 now.
On arrival, it's a major incident, with multiple police and ambulance teams already at the address.
Hi, Rob. Yeah. Roger.
2 neighbours have been attacked. Simon, who's outside, was stabbed while trying to defend his friend. 41-year-old Matthew, who has collapsed in the stairwell, has been stabbed twice.
Come on, breathe. Go on, deep breath out. Come on, you can. Okay.
He is struggling for breath. The stab wounds are close to his lungs, and they are in danger of collapse.
They put Kestrel on, I've not looked at wounds.
That's fine. Is he on O2? Hi, mate.
He's on O2 from police, not ours.
The wounds have been sealed, but with internal bleeding and potential organ damage, he's at high risk of going into cardiac arrest.
GCS 15, chest seal applied, oxygen on, and we're just going to get him gone and gone. He's got a good chest wound and a good abdominal wound.
All right, we'll put him straight on 463 with the crew are with him. The second crew, I haven't seen this guy's wound yet, but it's abdominal.
I'll have a quick
so I'm going to get this crew to bring their stretcher up, and we'll get this guy's.
If we just load it both and just get them all just gone straight off. I'm just going to grab an apron because I'm half PPE'd.
Once in protective PPE, Jack can make a close assessment of the other victim.
Rob, whilst they're dealing with him, I'll just have another look through this guy.
54-year-old Simon has one small but potentially deadly incision.
All right, can I have a little look, sir?
Oh. You okay, mate?
Okay, good.
You're all right.
It's a bit of bowel, but it looks little. Looks like there's too much there with lots of vein through it. Potentially that is bowel, but.
The stab wound has gone so deep, his bowel is now protruding out of his abdomen.
You okay, mate?
Okay, good.
If his bowel has been cut, he's in grave danger of sepsis, which can lead to organ failure.
So, hello, sir. My name's Jack, okay?
Oh, yeah.
Do you have any pain anywhere else? Have you been hurt anywhere else?
Yes.
Can we get this bag off you? Is that all right? Any hat?
Yeah.
I'm going to get this top off you, mate, okay? Just to check and make sure you've been stabbed anywhere else, all right? Okay, let's have a look in your arms. Nothing in the back. You definitely weren't stabbed anywhere else? No, there's no obviously bleeding, there's nothing into the wounds. Fine. Okay, good.
You all right?
Yes, happy for this gentleman on your stretcher. Is that the plan, Rob?
Let's get him, because the sooner he's moved, we
Yeah, let's go.
Suddenly, a fight breaks out amongst the bystanders, threatening not just the care of the patients, but the safety of Jack and the ambulance crew.
Ambulance service, is the patient breathing?
I don't know, though. I think he's underneath the bus.
Someone's been run over?
Yeah. With the fire engine coming as well, because they might have to lift the bus up.
Yes, I have requested for fire as well.
Hello, I'm actually a nurse. I spoke to the gentleman under the bus. He said he can breathe. However, his arms are trapped. He can't free his arms to get from underneath the bus.
Okay. We are coming to you on a blue light response and we'll be with you as soon as possible.
With a man run over by a 12-ton bus, the risk of catastrophic injuries is huge. So critical care paramedic Colin is immediately dispatched.
So Colin, just so you're aware, so it's coming through one patient. Man is still conscious, but still trapped underneath the bus. You have got a crew in attendance and OM is about to book in as well, over.
That's all copy, thank you. We're about 8 minutes away at the moment. Helicopter, helimed is going as well.
He's not trapped under the bus. His ankle is not by his head.
Sounds like he's going to have some injuries, doesn't he?
The incident is so serious, the air ambulance has also been scrambled.
I think it's really clammy, it was very little safe to get him out from underneath the bus. I had to drag him out and have an investigation on it.
12 minutes after receiving the call, Colin arrives and is briefed by the operations manager overseeing the incident.
He's just been trapped underneath this bus here.
Yeah.
His ankles were literally by his head.
Yeah.
This is as tight as you could get the bus.
Okay.
And we've literally just had to drag him out. It's literally 4
Yes.
drum and a half under
GCS 15 still? But...
GCS 15, yeah.
And you don't think he looks very well?
Peeling clammy from what we could see. We couldn't get any oxygen. So we literally just got him out.
Thankfully, just before Colin arrived, firefighters were able to free the man, and he's now being assessed by paramedics.
Has he said he's got any pain anywhere?
In his arm. Where's your pain?
Andrew, relax yourself.
Guys, take his clothes off completely. Get full monitoring on him. We need an ECG on him so we can monitor his accurate heart rate.
Yeah.
All right?
We've got a blood pressure here, Sam.
Yeah, 101 over 69. Good radial as well.
44-year-old Andrew was travelling to meet his wife when he stepped out in front of the bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Although Andrew is conscious, Colin is concerned. If he's broken his pelvis, he could have life-threatening internal bleeding.
So he's got no bleeding under there, but his leg was, you say, quite up above his head, yeah?
Down by his head, yeah. It's kind of bent over onto this leg was above there.
As a catastrophic internal hemorrhage can cause death within 5 minutes, Andrew's in need of urgent transfer to a major trauma centre.
60, could you just update me? Is HeliMed en route over?
How old are you, sir?
54.
In Birmingham, critical care paramedic Jack is working to save the lives of 2 men who have been stabbed.
So I've got no odds on him other than he's got a good pulse. He's looking a bit pale, as you can see. Single isolated wound.
With 2 patients on his hands, Jack decides Simon is in the most stable condition for the ambulance crew to take over.
I've not taken his trousers off. It looks like there may be some bowel there. There's like a nice vein through part of the flesh, so it could be quite fatty, but I'm not prepared to say it's not bowel.
Yeah, no, sir.
All right.
The other victim, Matthew, is still in the stairwell and in more urgent need of Jack's critical care.
I can travel with either. Probably this chest guy. Probably stick with him because he's going to be the sicker guy.
A bit longer, and if there's anything going to go wrong, it's going to be with him.
Yeah.
Okay.
I'm guarding these for their safekeeping. Please do not say anything. Stay there.
With tensions running high, police officers make a cordon to shield the paramedics from harm.
You guys have to get him on, and I'm going to start drawing out some TXA. Stand by. Life-threatening.
Life-threatening, okay.
Potentially life-changing. Yeah, you get him gone, get him gone.
Get him onto the truck, yeah?
I'll meet you there. Yeah.
So the dog ambulance can take you down to the ambulance.
It's vital Matthew is kept as calm as possible. With 2 deep stab wounds, any rise in blood pressure will increase the speed of blood loss and he could go into cardiac arrest. With a police dog escort as protection, Matthew is quickly evacuated to the safety of the ambulance.
Let him go now.
Yeah, go on, go. I know, yeah.
Try and get these doors shut. Yeah, I'm going to get one. Sorry.
6-2, go ahead. Very disordered scene. Can you pull yourself forward, mate, with my help? Matty, give us a hand. Now push yourself as far back as you can and get yourself sat up nice and high for me. Get your legs planted in, you've got good movement. You're doing really well. I know this is a really distressing time, but we're going to get you through it, all right?
Once on board, Jack gives Matthew a vital injection of tranexamic acid to try and stem the blood loss before updating the trauma desk.
I can't breathe.
So I have got a 41-year-old male. We've got 2 wounds. Okay, 1 non-sucking chest wound to the right anterior and 1 wound to the right lower quadrant.
They will alert the hospital to expect 2 critically injured patients who will need urgent surgery.
He's had TXA oxygen applied. The other patient is on the other vehicle. He has an abdominal wound, potentially a spat of small bowel visible. We are leaving scene now for the QE. ETA approximately 6 minutes.
While travelling on blue light, Jack closely monitors critically ill Matthew.
Is that pain a bit better? Yeah? Feel a bit easier? Good. Are you able to take a deep breath in for me? And out. Sore on that side? It's all right, I know, I just need this chassis to stick a bit. Otherwise it's not doing a huge amount. I don't think you damage your heart, I think it's your lung, essentially, or the space where your lung should be, okay? When the call came in to say we had 2 patients, both stabbed, potentially both unconscious, I'm thinking traumatic cardiac arrest, I'm going to have to really prioritise who's going to get my help first. Just twice. The trick with these patients is get going while the going's good and don't waste time. We're not going to fix their problems on scene. If they arrest on scene, we're in a whole world of trouble.
30 minutes after the emergency call was made, both stab victims are handed over to the major trauma team at the Queen Elizabeth Hospital, Birmingham.
Either of those wounds could potentially kill someone. The gentleman that I was with, he had air in his chest that was taking up space that lungs should have been taking up, so compromising his ventilation. The other gentleman, if he's nicked his bowel, that can be really quite complicated. Both are going to be at least life-changing and going to require significant recovery.
You got pain here? Pain there?
In Dudley, critical care paramedic Colin is dealing with a major incident at a bus station.
Do you take any medicine for anything, Andrew?
Epilepsy.
Epilepsy? OK. You haven't had a fit at all, do you know of?
No.
Andrew stepped out in front of a bus and was trapped under it for more than 20 minutes.
And we'll get morphine on the truck if you guys are up there. Yeah.
You will just give us the IV paracetamol for now.
Paracetamol going in, guys.
Andrew, you still here?
Yeah.
Good man.
Colin is concerned he may have life-threatening internal injuries.
Can we grab another crew?
Andrew, where does it hurt?
Just sat down, just feeling pretty shaky. And your shoulder. In your shoulder is there.
So is it you have the TXA or was that just being drawn up here?
Colin gives Andrew tranexamic acid to help stop excessive bleeding.
Just chuck it over this side, I'll pop it on this side.
Although they've managed to stabilise Andrew, they need to get him to hospital fast.
7062, what's some Helimeds ETA now over?
Colin checks the whereabouts of the helicopter.
What do you think about leaving scene to the QE?
Yeah,
because I don't think Helimed's going to do anything extra now.
No, it's BP 91 over 6.
It's come up a little bit, so don't worry about the fluids for now. We'll do it on the way.
Rather than wait for the air ambulance, Colin and the crew decide it would be best if he escorts Andrew to hospital by road.
Nice one. Thanks, guys. See you later.
A patient with internal injuries can suddenly deteriorate, so Colin's critical care continues throughout the 20-minute journey.
How's your pain now? Does it hurt anywhere? What happened? Do you remember?
At the Queen Elizabeth Hospital in Birmingham, Colin hands Andrew into the care of the emergency doctors.
Okay.
All right, Andrew. She's at the hospital now. All right.
Quite a serious job, especially in terms of the mechanism and potential a serious injury. I suspect he's injured something, I'm not sure what, which is why he's having a CT scan so he can find out. In terms of his observations, he didn't seem terrible, but I'm sure he's got something wrong with him.
As night falls, there is no let-up for the critical care teams.
So just have a check that there's nothing that's out of date.
At base, Dr. Ravi Chauhan and critical care paramedic Richard Apps have just checked in for their night shift.
It's not going to be a normal hot Friday weekend, and I think that's just because of what's happening with COVID, with lockdown and social distancing. But I suspect today will be probably quiet to begin with, and then maybe some RTCs.
I think you're being very optimistic that people are still behaving with lockdown. I don't think they've behaved for weeks. They've all gone mad. The job numbers are all back to stupid again now.
It's not long before Richard is sadly proved right.
Ambulance service, the patient breathing.
I don't know, there's been a fight. He says cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear me carrying on?
Yeah. Okay, so male adult.
Male adult by the looks of it, yeah.
And you said that he seems unconscious.
He's had a cold lump.
Have you got an idea what's happened at all?
It looked like it had a fight. It all happened really quick, and then all you heard was this crack. And I'm reckoning his head on the tile floor. He's bleeding. Or he's being sick. Whatever it is, it's not looking good. Can you hurry up with the ambulance, please? They're doing CPR on him.
They're doing CPR, okay. We are coming as quick as we can, blue light.
An ambulance has been dispatched, but the man's injuries are so severe he may be in cardiac arrest and in need of enhanced critical care from Ravi and Richard.
We are going to central Birmingham to reports of a unconscious patient following an assault.
Hi, thanks. Just a quick update from the scene. There's a few crews in attendance. The patient you're going to has a GCS of 3. He was hit over the head with something. He has his pupils, trismus. They report the scene as being very chaotic. They're scooping the patient and loading him onto the back of the ambulance. They're going to try and get bilateral IV access ready for you.
Yeah, that's received. If they are having airway issues, I would suggest that they go to nearest whilst we make our way.
Yes, absolutely. They were still on scene when I spoke. I think, from what I heard, you are going to make scene before they're ready to leave. Received.
Yeah, many thanks.
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain and to other organs. So if we're struggling with that, then we may have to act pretty swiftly. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
I haven't seen the vent or anything. Just sort of pushing through these checks in case we get an early job.
It's 7 p.m. and Dr. Polly Haywood is getting ready to start a Saturday night shift.
It's payday this weekend, so we could expect it to be busy, but obviously we don't know if people are not socialising as much as they might do with coronavirus.
Tonight, she's paired with full-time critical care paramedic Sarah Foley.
Yeah, that's the third one. Have you checked it's got enough masks and stuff in, or...?
No, the blue kit.
No, I'll have a look.
So this is a brand new car, so we're just kind of familiarising ourselves with it. We've got burns kit, maternity kit, including the slightly unlikely nerve agent protection. We've got snow socks. I hope we don't need those.
Don't think so.
Ambulance service, is the patient breathing?
Yes.
Are they conscious, awake?
No.
He's not responding to you.
He's not responding, no.
If you gently take his shoulder, does he wake up in any way?
May, can you wake up for me? May, can you wake up for me? No, he's not.
Okay.
He's been in a car crash, and a fairly big one. By the looks of it, he's lost control and is driven into a lamppost and then a tree.
Okay.
He was up and around for sort of 5 minutes. He lay down and then he sort of passed out through.
Okay. We are coming to him on blue lights.
A man suddenly collapsing after a high-speed road collision is a Category 1 emergency. An ambulance has been dispatched, but critical care backup from Polly and Sarah is also needed.
The patient has driven into a lamppost, then a tree. Only him involved. Patient was walking around after the RTC, then lay down. When you crash into motorway furniture or lampposts, they're all designed to deform. A tree is not designed to deform.
With over 1,700 deaths on Britain's roads every year, the team have to be prepared for the worst.
Hi guys, high speed RTC. still GTS3. He's got some contusions to his head that might possibly be isolated head by the sound of it. Blood pressure 134 over 82. Maximum respiratory, but they're quite busy on feed.
That's absolutely fine. Just keep us updated before they leave the scene. It sounds like patient would require an RSI.
Sarah and Dr. Polly are highly qualified to perform an RSI or roadside anaesthesia should it be needed.
Is there enough space in here? Yeah, I think there is, yeah.
When they arrive, the injured man has been moved to the ambulance.
Right, we're both going to have to done level 3, aren't we?
As Polly and Sarah may need to put a breathing tube down into the man's lungs, they both must wear the highest level of protection against coronavirus.
So, really fine mechanism. It's a little bit weird. Something that's quite adequate, to be fair.
While they dress, the paramedic updates them.
And he's come out of the car. He's been walking around for about 5 minutes, apparently. Yep. Witnessed by bystanders. Yep. And he's just collapsed. So he's been GCS of 3 with us.
A GCS, or Glasgow Coma Scale assessment of 3, is the lowest level of consciousness and a sign of possible brain trauma.
Hello, buddy.
Now in COVID protective suits, Dr. Polly and Sarah begin their close assessment of the patient.
My name's Dr. Haywood. I'm one of the merit team. I'm just having a feel across your chest wall, sweetheart, OK? He's got like a laceration there.
Yeah. So anything that to suggest that he's under the influence of anything? What's that?
Bit of a lack there, like a seatbelt lack. He's got a very firm belly, but all his numbers are normal.
Completely perplexed.
Although the man is unresponsive, his vital signs are good.
What's his name?
Matthew.
Matthew, have you taken something? Hold your arms up for me, buddy. Hold your arms up. See, there's tone in there. Hold your arms up. OK, hold it up there for me, buddy.
To assess Matthew's brain function, Polly checks his arm reflex.
This is all very odd, isn't it?
Yeah.
If he's unconscious, his arm should fall totally limp without any reflex. But as she drops it, Polly can feel the muscle tense, which is very unusual for someone unaware of what's happening.
So it seemed to walk at scene, but then...
Yeah, he got out of the car for about 10 minutes, was complaining about pain in his back, was fixated about finding his phone, and then by all accounts he sort of sat down on the edge of the road and then collapsed and was in this state from that point.
It's a mystery Polly needs to solve fast. Time could be running out for Matthew.
Let me just have a listen to his chest. There's nothing here on his numbers that makes me want to put him to sleep.
Dr. Ravi and critical care paramedic Richard have been dispatched to Birmingham city centre, where a man has been seriously injured after a fight. He's now on an ambulance. The crew brief Ravi.
What's going on?
This is Julian. He's obviously assaulted in the head.
Yeah.
I'll step up to GCS3.
Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
His right ear has got zero amounts of congealed blood. Pupils, left side sluggish and 3s.
Yeah.
Right side was reactive and 3s.
Julian is completely unresponsive and bleeding from his ear. All the indications are he has suffered a traumatic brain injury.
His trismus, we couldn't get an OPA in, so we popped an MPA in on the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access. He's been blood pressure stable throughout, and we've given him 1 gram TXA.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and it seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. as the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation stable, and have anaesthetics on standby. So we're not going to RSI here, but he'll probably need us. Okay, cool. All right, so that, bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, you know, we won't really know what his outcome's going to be.
In Oldbury, critical care paramedic Jack Lewis is making a mid-shift pit stop.
Never know how it's going to pan out doing this type of work. Could well get 1 or 2 more jobs before the end of the shift, but in case we don't, it's about kind of preparing, taking the opportunity while we can to get the car ready for whoever's on tomorrow, who might be rushed first, you know, out first thing. So we've still got a couple of hours left for things to happen.
Is the patient breathing?
No, I don't know. An old man just dropped and collapsed on the floor. He's heavily bleeding from the head.
Is he making a grunting or?
Yeah, definitely.
Yeah. Okay, is he awake?
Hello? Hi. No, you're not awake.
No, it's we've got the help on the way for him, okay? CKC Bell 2144, please go through the Cat 1, unconscious noisy breathing. ETA is about 10 minutes, please.
Roger, all copy, no worries, I'll give you an early update. Thanks, ETA approximately 3 minutes.
A man who has suddenly collapsed and reportedly unconscious is part of the reason the critical care team was set up.
We're about a minute out, we'll probably be first on scene. There's a crew also en route, but they're probably about 8 minutes behind us.
They are highly trained, able to administer life-saving treatments at the roadsides over and above regular ambulance teams.
Male in his 70s, unconscious, sounds like a collapse. Patient collapse, hit head. Hi guys. Hello, my name's Jack from the air ambulance. How are you? What's your name? Tony. Do you know what's happened, Tony?
Tony, a retired engineer, was on his way to his local shops when he fell and hit his head on the pavement.
Do you remember what's happened at all? No, you banged your head, you've given yourself quite a clock, I think. Yeah, Have you got any pain anywhere? Nothing at all? OK. So you don't remember what's happened, you've been seen to walk down the street and you've gone down and you've clocked your head. I can see you've got a nasty wound to your head there. Do you think we can try and roll you onto your back, sir?
I've got some shopping to do.
That's OK, we can do that a little bit later. Let's make sure you're well first. OK. Can I give you a bit of a check over, Tony?
Yeah.
Although Tony has regained consciousness, he has no recollection of what's happened.
Yeah.
How old are you, sir? Give me a rough idea.
64.
64. And do you suffer with any medical problems?
Nothing.
Nothing at all. Do you take any
He's also very confused. Tony is 75 years old, not 64.
I'll sit up next to you, it's whatever you'd rather. Do you think we can get this jacket off? I think you're probably a bit warm.
It's 27 degrees, and Tony is dressed for winter. Overheating may be one reason for his collapse.
Let me come behind you. Sit up for me. Good, man. Tony, can we get this jacket off? Just give you a bit of a check over. Have you had much to do? Any food, lunch today? Anything to eat? No. Much water? No.
Jack needs to be sure there aren't any other underlying causes, particularly seeing he already has another recent head injury.
Do you take any medicine to thin your blood? No. OK.
Tony's displaying some concerning symptoms.
Do you take any medicine for anything at all? Nothing. OK.
His sudden fall, difficulty speaking clearly, and confusion could all be signs of a stroke.
Very flat, isn't it?
In Shrewsbury, Dr. Polly and critical care paramedic Sarah are dealing with a puzzling case.
Buddy, come on, matey.
Matthew has had a high-impact car crash and appears to be deeply unconscious. But Polly thinks he may have some awareness, and for an unknown reason, can't move or respond to her.
Inside of the vehicle.
Have we got big intrusion? He has got a shift there, hasn't he, into the centre console.
The back and there.
To try and establish what might be causing Matthew's paralysis, she looks at photos of the crash to see if she can glean any clues.
By all accounts, he was into a lamppost, then onto a tree.
So with those scene photos, we need to go to major trauma centre. The options are we tube him, or we take him straight and we tube him if necessary. His numbers are perfect. He looks good. He had voluntary swallow. Been watching him swallow.
Just not wanting to respond to it, is he?
No.
Having examined the scene, Polly suspects Matthew has internal injuries. She tries one last time to wake him. She gives his skin a sharp pinch to see if he has any response to pain.
I think on paper we are GCS3. I have given a really big painful stimulus.
Big mechanism.
Big mechanism of injury. He's got voluntary eyelash reflex. He's got some swallow. Yeah. But I've given a very painful stimulus and no dice. Right, we'll go to Stoke, walk us into sleep.
I'll just tell the OM and exactly what we're doing and I'll set it. Hi, you're right. So it's a long journey to Stoke. We're going to put him to sleep, but something doesn't add up here. He's just not responding to pain.
We're doing the RSI here then, are we?
Yes,
okay,
yeah. Is that all right?
Concerned Matthew may have a brain injury that could have life-changing consequences, Polly decides to put him into an induced coma to reduce swelling in the brain, protecting it from further damage.
Our journey time up to Stoke is about 35 to 40 minutes. So we're just going to quickly pop him to sleep for the journey and then he can go straight into a CT scanner to assess him for his injuries. Although we can't physically see any injuries on him at the moment, he's not waking up.
Matthew! Matthew! I'm having a look at his airway. He's got a smallish chin, but that looks pretty reasonable.
There is always a risk putting a patient into a coma, but doing it on an ambulance, 35 miles from the nearest trauma centre, the stakes are so much higher.
We'll optimise our airway position.
So the ventilator's working, I'm going to turn it off for now.
And what have we got there? Ket, rock, a bag of fluid for flushes.
So I think we're pretty much there now.
The checks are done, drugs drawn up, Polly is ready to anaesthetise.
Oh, hello. Oh. All right, buddy. That's about on time.
When Matthew suddenly comes round.
Matthew, open your eyes. Hello, buddy. You're on the back of an ambulance, sir. Matt, open those eyes for me again. So we've had voluntary eye opening, that's great. Obeying commands, 9. Can you talk to me, buddy? My name's Dr. Haywood. We're near Shrewsbury, fella. You've been in an accident. Hi, Matt. I know we're dressed up like out of something like out of ET, all right, but you have had a period of being unconscious. Do you know where you are? No. So I think what we'll do is we're all ready to go. If we give you a nod, we can RSI on the way. There's no indications to put this patient to sleep.
As Matthew is now conscious and responding to Polly, the anaesthesia is aborted.
Have you got pain anywhere?
Everywhere.
Everywhere? Where hurts, fella?
There.
Your back and your neck. OK, sweetheart. So if you can bring that neck a little bit straighter, we're going to just tape you here to keep your neck nice and still, buddy, OK? Have you got pain in this tummy? Are you OK? Or is it in your back?
Belly.
Belly in your back. All right, sweetheart. Right, let's just leave sooner rather than later.
Matthew may have spinal damage. He needs an urgent CT scan to check for any fractures in his vertebrae which could cause paralysis.
We have a 28-year-old male who was a driver of a car, high speed, impact into a lamppost and a tree.
Sarah updates the trauma desk on Matt's condition and to alert the hospital of their arrival.
Was a GCS of 3, but still had eyelid reflexes in the way of blinking when you touched his eyelids, but there was no response to pain.
Dr. Polly continuously monitors Matthew during the journey to Stoke.
Got it. Okay.
All good, yeah, thank you.
Okay, just monitor.
50 minutes later, the critical care team can finally hand Matt over to the waiting trauma doctors.
Blood pressure's good, you are quite tacky. I think you're probably quite dehydrated.
Critical care paramedic Jack Lewis is treating 75-year-old local resident Tony after he collapsed unconscious in the street.
Have a little bit of water for me.
He has a nasty head wound and may have a bleed to his brain or suffered a stroke.
This is Tony, so Tony's fairly regular fixture around here.
An ambulance crew has arrived to take him to hospital. Jack briefs them on his initial assessment.
He's walked down the street a bit unsteady, held onto that and then collapsed, fell to the pavement, hit his head, as you can see, with a brief period of LOC. On my arrival, GCS 14, sat himself up, no obvious neck pain, not complaining of pain anywhere else. Wound here, not actively bleeding, a bit boggy and a bit kind of angulated.
Right then, Tony.
We'll get you on this stretcher, Tony.
You on our stretcher?
Legs together, that's it.
Ready to push? 1, 2, 3. Good man.
Tony needs an urgent scan and full investigation into the underlying cause of his collapse.
I'll pop you up to Russell's Hall to get your head looked at. Why? Because you've cut your head.
That's 3 or 4 days more.
It's not. You've done it today.
You've got a nasty bump as well.
Not today.
All the blood on the pavement says otherwise.
Jack knows there could be many reasons for Tony's confusion. Heat exhaustion, dehydration, or something more life-changing.
GCS 14 initially.
You don't remember falling at all?
Not today.
No. Okay.
Even more reason to pop up the hospital then. Need to get that looked at.
After updating the trauma desk on his assessment, Jack has done all he can for Tony at the scene.
Take care, Tony. Feel better soon, sir. OK.
And hands him into the care of the ambulance crew for the journey to hospital.
Better.